Everybody, thank you for joining us here at City Hall for this joint City County Commission special meeting. It's my honor to welcome our colleagues from across the street here with us, as well as all of you. We have a very long agenda today, and there are a couple of things that we need to consider as part of this that were not initially contemplated. The city has a particular item that we need to squeeze in because time is short on the decision making for this. District Attorney, would you come up and tell us about this? And note that we do have Commissioner Book joining us on Zoom. So.
Thank you, Mr. Mayor, and I appreciate your patience with us, colleagues with the county. We have a little bit of an unusual situation causing an addition, very late addition that we'd like to put before you. Basically, the airport authority contacted us yesterday through their CEO, Mr. Penska, that a grant application had been unexpectedly offered very quickly with a very short turnaround time for signatures, and due to the sort of vagaries of the calendar, your next two regular meetings fall on Juneteenth and during the 4th of July holiday. So there's not another regular meeting within that 2-week period. Typically, we would present those before you in the form of a resolution with the commission recommended to direct the mayor and my office to sign off on the grant agreements. And I provided copies of those to you. It's a very late hour just today, and asking that you direct or authorize the mayor and my office to sign off on that grant agreement. It's a $3 million grant agreement. The good news is I think Chair Carter was just before you last Thursday discussing these very projects. So it's a $3 million grant, so it's certainly important to them, to the community. And we will follow up, if that authority is given to the mayor in our office, we will follow up with a resolution at your next meeting to sort of tie a bow on it.
Very good, thank you. So whoever makes the motion for the city, if you would please consider adding that at the top of the agenda, first a business discussion item, but also if you would consider adding a manager comment item toward the end, primarily for the county to be able to answer some constituent question that has come to me in the last day or so, if we could do that. So having said all that, Commissioner Willits.
Mr. Mayor, I move adoption of the agenda with the addition to authorize the grant agreement 59, and then at the end of the agenda to add managers, both managers' comments.
Very good. Second. All right. So motion second. Any public comment on that?
No public comment.
Okay. All in favor for the city, please say aye.
Aye.
Aye. Any opposed?
Aye.
That passes unanimously. Mr. Vice Chair.
Thank you, Mr. Mayor. So it's certainly a pleasure to be here. Chair Chestnut will be joining us shortly, so I was asked to kick off the meeting. And so, Commissioners, I'll look for a similar motion. The same agenda?
Yes.
Second? Okay, great. Michelle, I want to go ahead and the manager comment, if we could just give an update on Celebration Point. That's the key. Okay, that sounds great. Is there any public comment to the motion on the floor? Seeing none, back to the board. All those in favor say aye. Aye. Any opposed? That motion is unanimous. Mr. Mayor, back to you.
Very good. Madam Clerk.
Mr. Mayor, we have the approval of minutes from the March 24th, 2025 joint city-county meeting.
Mr. Mayor, move approval of minutes from March 24th, 2025.
Second.
We have a motion and a second. All in favor, please say aye.
Aye.
Aye. Any opposed?
Aye.
All right, that passes unanimously. Mr. Vice Chair, did y'all have any minutes? Or
We didn't have that on our agenda.
Okay. All right. All right. Well, there we go then. Madam Clerk.
Mr. Mayor. Okay, hold on. I was trying to open a bunch of error messages. Hold on one second.
So I assume this is going to be the attorney's item for the airport.
Yes, so it is authorization to execute grant agreement related to FAA AIP Grant 59 for the Gainesville Regional Airport.
All right, Mr. Attorney, anything else you want to add to that?
I think I laid it all out. Our recommendation is that the commission authorize the mayor and city attorney to execute and the city clerk to certify the grant agreement.
And is there anybody from the airport here with us? I don't think so.
We've been in communication with Mr. Penska. I know Forrest usually serves Mr. Edelton as our liaison with them, and he's here as well to answer any questions.
Thank you. Commissioner Willett.
I move the city commission authorize the mayor and city attorney to execute and the city clerk to certify said grant agreement, AIP Grant 59.
Second.
There's a motion second. Is there any public comment on that, Madam Clerk?
No public comment, Mr. Mayor.
I see no further lights. All in favor, please say aye. Aye. Any opposed?
Aye.
All right, that passes unanimously. Madam Clerk.
Mr. Mayor, we're on to our discussion items for the afternoon, 2025-468 Eastside Urgent Care Clinic update with recommendation, the Joint City County Commission. Here, a presentation from UF Health staff.
Wonderful. Welcome. Glad to have
Thank you
with us
so
today.
much. Good afternoon, everyone. I'm the practice manager for the new UF Health Urgent Care Eastside Clinic.
Wonderful.
I'd like to give you just some updates on some of the things that we're doing in the community and how it has been really a great project for the community. One of the things that we're doing currently is we're providing an alternative to the emergency room for the bumps, the bruises, the cuts that are coming into the emergency room to kind of take some of the weight off the emergency projects. We're also here to provide care for a lot of the underserved population in the Eastside Gainesville community. We want to be here to fill the gaps for the area for the family medicine practices as well. One of the things that we've done or have accomplished a lot of is taking some of the weight off of some of the family care practices, as well as the ED, the University of Florida Shands ED. So we've been very good at that. We've also partnered with the Mobile Food for Pharmacy program, because we know healthy people don't have to come to the urgent care of the family medicine. Amen? Okay, so the next thing is I want to talk about just briefly in the PowerPoint. I don't know if I'm doing the PowerPoint or somebody else is doing the PowerPoint.
You should have the clicker right there beside
Right
you.
here?
Yeah, yes, ma'am.
Okay, perfect.
Maybe. There we go.
No, it's not. There we go. There we go. Happy about that. One of the statistics that I want to give today is looking at the mix, the diversity that's coming into the Eastside Urgent Care Center. As you can see from a gender basis, we get a lot of females. We get a lot of pregnant females. We get a lot of females from just different genders and races and backgrounds. And then our next highest is the 38% for the males that we get into the clinic. It's broken down. It's a diverse set of people. Since the east side of Gainesville is underserved and mostly populated with African Americans, we see a larger proportion of African Americans in that center at 50%, as well as 42% for other races, as well as a mixture of multicultural you'll see up there that ranges in about 23% of the people that we see. So there's a diverse group of people outside of just the community coming into that center. We serve a full range of individuals. The ages fluctuate a little. You'll see in the 65% range, we see anywhere from 18 to 64-year-olds on a daily basis. Next to that are our 65 plus. We've got a large elderly population coming into the center. And then we're starting to see, shocking to us, a lot of peds. We're getting a lot of pediatrics starting to come through the center on somewhat of a flow. Next, I want to just talk briefly about the ages, the age variations that are coming through the center. We see predominantly by age those 84 to the 18s to 64s, but what we've seen lately is we're getting sicker 18-year-olds to 64s. We've had to call 911 several times because we're getting a sicker population of people. So we have decided to do more community education to kind of tell or curtail a little bit a lot of those individuals so that they learn what is urgent and what is emergent. You know, we've had a couple heart attacks walk into the urgent care center. And so, you know, that's like a prompt for we're trying to get 911. We're trying to stabilize them as best as we can. We actually had a stroke victim walk in yesterday. And of course, that was kind of paranoia for the urgent care center because we're actually not equipped to actually facilitate a stroke on site. But because of this center and because this center is where it's at, we can actually do a lot more for saving lives as far as stabilizing them until we can get EMS services on the property to take care of them. So that's been a great blessing for the community. When we look at visits, these are the visits from February 23rd through May 11th. We did 1,952 visits at the Urgent Care Center. But as you know, today we're already in June, and I wanted to give our total amount of visits that we've seen so far through today in June's 2,527 visits. So we're pumping along. We're doing great. Some of the common diagnoses that you see are UTIs, bronchitis, pharyngitis, coughs, chest pains, and we get other signs and symptoms. But in all, we've really built a great urgent care center that the community is utilizing. Like I said, with additional education, which is one of the things that we're doing right now, is educating the community. We want to educate them on proper prior, going to the doctors like you're supposed to with family medicine versus waiting until there's an acute, symptom going on and then coming into the urgent care. We're there to help them. We do help them. We welcome them in. But I think the urgent care center's been just a positive motivation for the entire community. When I looked at our KPIs, and they're not in here now, pull our KPI scores up, which are the scores that measure what the community thinks about you, and if the community thinks you're doing a good job. And I pulled up our KPIs this morning, and they were at a 93%. So as a whole, we're doing a great job for the community. I know the community appreciates us, and we thank the city of Gainesville and the county for supporting this well-needed program. Thank you.
Very good, thank you. Let's see, that is. Commissioner Chestnut, yes.
Thank you, Mr. Mayor. And thank you, Ms. Director. Want to come back to the microphone? Thank you. Thank you. Have you had to adjust your hours since opening? I know you what I'm getting at is that, are you seeing primary care patients as well as urgent care?
Yes, we are.
Okay, would you talk about that, please?
Yes, we are. So with the diversity in the area that we're in Gainesville, in the east side of Gainesville, they are an underserved community, but they're also a community that's not as educated on, I need to go to the doctors early. If I go to the doctor earlier, then some of the signs and symptoms that are presented to us, we wouldn't get because they'd be going to family practices. We've extended our hours in the community as the urgent care center because we're trying to capture everyone at different times of the day. I will say this, as far as the center's hours, we see predominantly about 80 to 85% of our people come in from 10 to 1 o'clock. Then we have a flat. We kind of go really flat. We pick up again around 4 to 6. And then from 6 to 8, it kind of goes, downstream. And I say that to say it has a lot to do with people's work. There are times that they go into work, their employment. And so we've been seeing just a fluctuation. We're trying to work with the fluctuation right now. We do see a lot of urgent care patients that we turn over into primary care until we get Cornerstone open, which is what we're working on right now, the primary care piece for the urgent care center. We've been sending them to our Eastside family medicine practice. So we are seeing a complete kind of a chain. We get them in urgent care, we educate them in urgent care, and then we send them over to the family care practice to start getting them consistent care.
Well, I want to say thank you. You're doing an excellent job. And exactly, I think, what we had anticipated. But to see 2,500 people since opening, I think is just tremendous.
It is. It's great. It's growing every day.
So this is a very good investment. Thank you.
Thank you.
Thank you, Commissioner Chestnut. And then before we move on to the other folks who want to speak here, you mentioned until you get the Cornerstone office open. Can you tell a little bit more about that?
Sure,
That's important information.
I'd be happy to. So That's the second piece of the urgent care center. So where we're situated, on one side of the facility will be total urgent care. There are 5 working rooms right now for the urgent care side. We have 5 rooms on the opposite side that will be utilized primarily for Cornerstone, which is going to be the family practice for the urgent care center that sits there. I'm excited about it. I have to take my glasses off. I'm excited about it, and we've been driving a lot of interest for it. As they come into the center, we're constantly telling them about it. We're giving them information about it, and the entire area is excited about having a family practice and an urgent care center side by side. So it will be a dual modality. It will be a dual practice that will sit in the same building. You can come in for urgent care. If we see something going on and we think you need follow-up, we need to monitor that. We need to try and work with you on your diabetes or work with you on your heart condition because you've shown up for urgent care. We will then be able to just transfer them over into our Cornerstone family practice. So
That is perhaps more exciting than having the urgent
it's
care
very
itself.
exciting, yes.
And again, before I move on to the other folks here, I did want to also introduce Dr. Michael Holmes, who is the
Yes.
Gainesville Regional President for
Yes.
UF Chance. I appreciate you being with us today, sir, and welcome to the community. We're so happy to have you with us.
Yes.
Well, thank you, Mayor and Commissioners. It's good to meet you. It's good to be a part of the Gainesville community. I joined UF about 90 days, so I've been learning quite a bit about our community, and I just want to acknowledge the relationship that we have together here. So I do, as I get out and around and meet folks in our community and get familiar with the community, see other opportunities for us to be able to expand. So thank you for your comments on the great work. We look forward to working with you long into the future.
Wonderful. Thank you so much. I also want to recognize Melanie Blackburn, who is Vice Chair of Administration. Thank you for joining us here today. I appreciate it. So we have lots of questions from commissioners up here. We won't hesitate anymore on that. Commissioner Alford.
Thank you. I don't have a question. I just had a comment. I have a lot of family members that live in the East Gainesville area, and one of them developed an acute case of pneumonia, and I took him to the urgent care center. And I want to say that I waited in the car thinking and settled myself in for what I assumed would be at least an hour wait. And he was in, got an x-ray, met with a doctor, got lab work done, and was out in 20 minutes.
Yes.
I was incredibly impressed, and he was incredibly impressed and said he'd prefer to go back there if he had to visit an urgent care center again. So I just wanted to thank you for the excellent care and for providing a pretty much a seamless experience for someone that was pretty sick. So
Thank you so much. We appreciate that. I'll let my staff know.
Please. Thank you, Commissioner Alford. Commissioner Prizia, is that right?
Yeah, I'll echo my colleagues in saying thank you for putting together I guess a facility really that's been responsive. You've shifted hours a little bit as things have happened. You've thought about the fact that primary care is really a driver of need and added that and thinking about how that drives business to you, but it also means that we're answering a need in the community. So I'm really excited to see that you all are adding that. I have a comment and a question. I'll do the question first. The question is, we had talked a little bit about pharmacy when you all were first opening, and I wonder if that's still something you all are looking at, or if you've been in conversations with anybody around the kiosk pharmacy or some of the common formularies.
Absolutely. So I'll help with this because Tony came on shortly after we launched. I think some of you met or worked with Galen. So we are still in conversations about that. I think predominantly we wanted to start up with the imaging, get Cornerstone rolled out. There still are discussions about potentially doing a kiosk of some sort. Right now we are referring them to other clinics that might have those facilities or our primary pharmacy. But it's not at the top of the priority list quite right now, but it is still on the list.
Okay, great. Thank you.
Yeah.
And my only comment was I'm really excited about the food as medicine effort and the mobile food efforts. I think that really shows how you're seeing how we can get to the root causes of the issues of health and and unwellness, and start to address those. And the county actually has been working on looking at a business plan and feasibility study for what's called a food hub, which is a place that works with our local farmers to aggregate fresh produce and get them access to new market opportunities, particularly institutional market opportunities. So would love to connect you with our economic development staff that are working on that, so they could loop into this food as medicine effort, and also speak with your folks that provide for your cafeterias. So we could sort of loop in economic development, local food, health and nutrition all together.
I think that'd be awesome.
Thank you so much.
That would be awesome.
Thank you, Commissioner Prizia, and I think that's Commissioner Wheeler, is that right? And I will tell you all, it's not that I don't know everybody up here, it's that our light system
right.
is up
That's
a
right.
little bit different than it normally is.
That's right, that's right. Yes, thank you so much for the presentation. I was anxious to hear how it was going because I pass by there pretty regularly. And I too was concerned about the pharmaceutical access to pharmacy, because my question for you now, since Anna has already asked the question about the pharmacy, is transportation. How are you seeing people get to the clinic? Are they walking, driving, biking?
Variation.
Okay, are you hearing that there are problems with getting to the clinic? In terms of transportation, see, the transportation question is what would go along with the pharmacy question, because a lot of folks are having difficulty getting from place to place. And if they are indeed in trouble in a late hour and can't get to a pharmacy, then, it's not as helpful as it could be.
I found that from what I've learned from being there, transportation has not become a huge issue.
Good.
With a lot of the people that we have coming in there. There is a city bus now that is actually advertising the urgent care center, which I love. That was a great idea. And because of that, it's bringing in a lot more community awareness. So our biggest thing was making sure that the entire community is aware that we are there. We're there to serve you. So we've been pushing out a lot of different things inside to allow everyone on the outside to understand we're here. We're a full service urgent care center, and soon we will have that family care practice. But as far as transportation,
Does the bus go there?
it stops
right there?
like probably,
Okay.
I'd say 15 feet.
Okay.
Right past it. So it's a
Great.
very short, walk to the urgent care center. And there have been times when different individuals have come in. There is a program, I have it on my desk. They provide vouchers for individuals. And so I met with a young lady, and we're supposed to be working on a voucher system because it is for underserved people. And once we can get that system in place with the vouchers, the people that do present and can't afford, they got there, they can't afford, we now will have a voucher system. We're working
So
on
maybe that
as
bus
well.
could help get them up to where they need to get their
Yes.
pharmacies.
Yes, so.
Okay, all right. Well, and if you all would help them know that too, as
It's
part of
that
the
education piece, yes.
Yeah.
We're trying to push out as much education in the various areas as we possibly can.
Great.
So that they'll-
Thank you for that too.
You're welcome.
And for your good nature, obviously.
Oh, you're welcome, you're welcome.
Thank you, Commissioner
Thank you,
Wheeler.
Mr. Mayor.
And I want to note too that, speaking of transportation, we have through RTS an on-demand system that is available in the evenings, free,
Okay.
that serves most of southeast Gainesville and parts of northeast Gainesville as well, that can get you from wherever you are to the clinic for a portion of the evening on weekdays. It's not available all day long, but in the evenings, it is available. It's free, and it's on demand, point to point. So that's an important thing. We don't have time to go into all that today, but that is available. So, Vice Chair Cornell.
Thank you, Mr. Mayor. I want to echo my colleagues' comments about how appreciative I am of the responsiveness and really adapting to the needs of the community on the ground in real time. So I want to thank you all for that. Just two quick questions. What percentage of the 2,527, approximately, what percentage of those individuals do not have a primary care physician?
On the average, because I'm a number cruncher. So on the average, probably about 48% of them don't have a primary care, yeah.
And what percentage of them are uninsured?
Probably about 60 to 70.
60 to
We
70.
get a lot of uninsured individuals coming in, and so we try and do sliding scales with trying to help them. We normally charge $125 if you have no insurance. A lot of times they can't pay that, so we only ask for maybe 10% to get them in, to get them seen, and we will bill them for the rest. So we are dealing with the issue of affordability and things like that, but we're trying to work with the individuals in that area. So.
Well, I know it's a long-term commitment. I know, we've talked about if you build it, they will come, and especially when they become more aware, they will come. And so I, again, want to reiterate Commissioner Prizzia's point of how much we appreciate you being responsive, adapting, and hopefully we can help with that awareness. So thank you so much. Thank you, Mr. Mayor.
Thank you, Commissioner Cornell. Commissioner Duncan Walker.
Thank you, Mr. Mayor, and thank you for this presentation. I did have a couple of questions and a couple of observations, but I do want to kind of speak to something that I was glad Commissioner Prizzia brought up to first with regards to what may be the addition of a pharmacy a little bit later on. Thank you for that in advance. I would like to just throw out, and perhaps you'll do this automatically, but as the D1 commissioner and somebody who has lived in that area for many, many years, someone who helps aged parents and a 99-year-old grandfather, and someone who travels elsewhere for our services at this time, out of necessity. When you're looking at the pharmacy, if you could and will consider the hours up front. Now, I understand some of the challenges that you face, but one of the issues for a lot of my constituents, as well as my family, is that pharmacies, particularly the Walgreens that's on the street, kind of closes a little bit early. And sometimes you need to be able to access your medications and after that closing time. So I wanted to just say that if that is something that you can kind of start considering up front and even enter into conversations with the community about that need, that would be wonderful. I did have some very specific questions that I'm sure may require a little bit of going back to the books, and that's okay if we can have a conversation later as a one-on-one, or actually if you could provide it to this entire commission at a later date, that would be fine. I'm just curious about the cost per visit.
Okay.
The cost per visit, and also, even though we're still kind of early on, the percentage of returning patients.
I can give you the percentage of
You
returning
can?
patients.
Thank you. Yes, ma'am.
Cost per visit will vary just because of the various procedure codes and what they're having done, so that's a variation.
Yes, ma'am.
But the returning, that's my KPIs, I love those.
Yes, ma'am.
So we've had about a 68% return
Okay.
on the patients that have been coming there. We see it, a lot of them actually utilize it right now as their primary care. So we see return. We know the families, when they sign in, you'll see the MAs, the nurses going up saying, "Oh, hi, Miss So-and-so," because they're a regular there. So we have a lot of returns. That's why we're so excited about the family care practice, because they're waiting. They're in wait for it to open. So
Oh, sure. Oh, sure.
we have a high percentage of returns.
Yeah, the family practice is definitely a long time coming. So how are you currently measuring patient satisfaction? How are you measuring it?
KPIs measure a lot of patient satisfaction. We ask questions. There are certain questions that we ask. If they sign in on the kiosk, that's been another learning tool for a lot of the people in that area. They're not used to having to deal with the computers and the kiosk, so we've been training that. We have one of the staff that actually goes out and will stand with them. And when they're on that tool, they can actually tap different things about their service. If you're a return patient, would you recommend this service to someone else? Would you tell someone in the community? And we have cards that we can give them, and they write in, and they can send in how they feel about different things.
Okay. So you're measuring it electronically and you're measuring it through a card, a physical card that they can turn into you right there. Okay. We've heard about marketing, and I'm excited to know that you are doing some things. Okay,
Yes.
I've heard about the bus that's going by. Can you tell me a little bit about how you are marketing your current educational efforts?
Our educational efforts are right now in the kind of development process because we want to be strategic. We didn't want to just put something together and send it out to the community and say, hey, you need to read this, this is what we're doing. So my thing was, so let's be strategic with it. Let's get a marketing plan together. Let's get different individuals together who can take this same message out into the community so it's repeated the same way. One of the first targets that we're looking at in marketing is the African American church in that community, because a lot of those people are big in their churches. So we want to go to the churches, we want to go to the local businesses, we want to go to the places, pinpointing those places in the community where most of that community actually socializes. So we put a team together, I put a team together, I guess, also with Pastor Duncan and some of his people, in actually looking at, and that's the mobile food pharmacy, and actually looking at where are the places that we need to strategize on, where are the places where we can meet them at the point of their need and actually pull them in while educating them. So it's a plan that we're putting together right now. We're actually working on it, getting everything, because we don't want a scattered marketing attempt is not a good marketing attempt. I believe if we're strategic about it, if we look at where we need to pinpoint and who we need to see, then it's going to have, it's going to have the most effect on the people. So,
Do you know when that'll roll out?
August.
In
We're
August.
I'm looking
Okay.
at it on August 1st. It's so interesting you asked me that, because Melanie, who I report to, sent me a report this morning and said, so when are we going to launch this? I'm like, we're working to get it completed by August. So.
Okay, thank you. I'll conclude my questions for this time.
All right, thank you, Commissioner Dr. Walker. Commissioner Chestnut.
Thank you. Thank you, Mr. Mayor. Is there a pharmacy unit at the Eastside Clinic?
There is pharmacy support there, so we have PharmDs that do provide support and rotations there, but there's not an actual pharmacy at that location.
All right, thank you.
Yes, ma'am.
Okay, my next question. At one time, not at one time, but during the formulation of the facility, we talked about having a community advisory board. Have you all established that yet? That would help you in the marketing. But we were going to get people from the community, many of them who participated in the whole development of the center.
So one of the things on my to-do list right now following this meeting is to set up, I think we agreed on a biannual meeting. That would be a combination of hospital leadership, departmental leadership, city, county, and community. And so it would allow us to provide regular updates as well as have continued discussions about the things that we want to see at the facility, to include pharmacy and things of that nature.
Okay, I think one thing that was effective when the Eastside practice opened was having that community advisory board. So you might look into that. And as you work with the churches in trying to distribute information, I would suggest that you also look at hair salons.
That's on the
Because
list.
hairdressers serve as psychiatrists and psychologists. And also look at barbershops for distributing information. Thank you.
Very good. Thank you, Commissioner Chestnut. Do we have any public comment, Madam Clerk?
Public comment.
Mr. Mayor,
Yes, Commissioner.
if you're ever curious as to why we don't often hear from our city attorney, it's because his button doesn't seem to work.
Why did you tell him that?
So I don't know if you want me to like throw a pencil at you or wave my arms or what it is you'd like me to do, but I can't get in line. So probably a good choice by the staff to put me down here. I did have one thing to say on the subject. About 2 years ago, it was Thanksgiving weekend, so my regular primary care was closed, and that shingles popped up. Highly don't recommend getting shingles. Another advice to anyone: go get the vaccine if you're able to. It's terrible. But because my primary care wasn't open, I went to what I thought was an urgent care center, but that was because I did not know the difference between an urgent care center and a standalone ER. And the bill I got for about a 30-minute
That's right.
going in, getting a prescription, and leaving was $7,000. My insurance knocked it down to a reasonable $2,500, but having these kind of options where you've got something besides the emergency room in an area that's as underserved as this, and I lived right across the street from this clinic for many years, so I'm very familiar with the area, is huge.
Yes,
So
it
that
is.
basically, if you have to go to the emergency room for care, you're just going to be carrying debt because they're going to charge you way more than you can ever pay, and you're going to have that hanging over your head for a long, long time. So having these type of options where you can go in for a couple $100 and sliding scale and being
Yes,
able to work with people
yes.
and making it the type of thing where, again, when I was growing up, you went to the doctor if you were about to fall over because we couldn't afford to go to the doctor otherwise. And getting out of that cycle, I think, is really important, and this seems to be a very good step in that direction, and I'm very happy we made this investment together.
Very good.
Thank you.
All right.
Thank you.
Thank you. We'll turn your light back on if you keep making comments like that. Commissioner Duncan Walker.
Thank you, Mr. Mayor. I did want to add just one additional thing. As you're looking to build out this effort and move from just urgent care into the primary care piece, one of the points of research that I had done a few years ago was through a Center of Health Equity. And I made mention of this when I first came to the commission and was a part of my first conversation around this. And I wonder if there may be an appetite at UF Health to, as you build out, to kind of include that kind of outreach, because you are where you are, and because the mission, by virtue of where you are, has to be what the mission is. Johns Hopkins has a very, very interesting program that I wonder, and because it's been around for a very, very long time, and they've been very, very successful at pulling in the community to get their buy-in, but also to really start to try to move the needle on impacting the healthcare disparities that East Gainesville does suffer from. I didn't want this conversation to end without mentioning that, because for me, it is all about outcomes. And it's good for us to be finally moving the needle on addressing access to the care, but also the outcomes of actually mitigating and minimizing the disparities that come along with this. I heard you mention that some of the people have come in having suffered a stroke. They came to you. Some of the people have come in complaining of chest pain and going into heart attack. So I'm very curious and hopeful, and we'll get on your calendar to have a conversation about what something like that could be here, because it's having an impact in different locations where it exists. And if UF Health is willing to enter into that conversation and possibly move in that direction, I believe we'll actually begin to see some shifts, because a huge part of it is the education piece. I've heard you mention that a lot. That's part of what they do. It combines with the research in their institution, and that kind of outreach and pulling the people in to address healthcare disparities and inequities in a very intentional way is something that I'm very, very interested in, and hopeful that we can have a different and deeper conversation about it at a later date. Thank you.
Perfect, thank you. In my past life, one of the things that I've delved heavily in was social determinants of health. And I think that's where you're at and you're going. And so we can dig a lot deeper into the social determinants of health, because they give you the numbers and they make a difference in the communities that they serve. So.
Thank you, Commissioner Duncan Walker. Commissioner Prisia.
Thank you. Just something that she said jogged my memory. I know you love that when you're trying to move on from an agenda item, but I would be remiss if I didn't say it. And it was two things. One is again, another question and a comment. The question is, I know you have the new OB/GYN bus, and I've been a part of the Access Network that's been supporting Dr. Adetola in the conversations about how that's rolling out and sort of the overall support of that, and the new doula certification. So I wanted to say thank you to UF Health for all of that work, because talking about health equity, that is a huge social determinant of health, is the outcome, maternal health outcomes in our community. We have some of the worst in those neighborhoods, so it's really, in those zip codes. So it's really great to see that. And I was wondering, is that working directly with the urgent care clinic in Cornerstone, given that you're seeing so many peds? Are we having that bus visit, or is there a coordination?
We're scheduling the bus visit. So the bus kind of goes around to different centers. And USUC will be one of the centers that it actually stops at as well.
Awesome.
One of the other things kind of to add to that is we have a classroom, a community center. And so we've been scheduling a lot of classes on maternal, care, how to, take care of your newborn baby. Classes that are helping the community. So we've got a lot of prenatal classes. We've got a lot of different classes coming through there on a weekly basis. So
that's fantastic. That's great. And then the comment I wanted to make was just that I think that I know that there's been conversations I've had with other members of the UF Health community around the fact, and some of it came out in the Access Network conversations and in other community conversations about you all screening now for some of the social determinants of health and actually asking some of those questions. But I know that, having information is power, but it's also a responsibility, right? And so beginning to understand those needs, I think, is going to raise a real level of understanding about the intensity of that need in our community for things that are responding to the social determinants of health, things like employment, things like food assistance, housing assistance, those sorts of things. And so I just wanted to encourage U of Health to include us in the conversations about that, because we have a lot of resources at the county that we provide support in those areas. And Claudia Tuck, who's right behind you, is our Director of Community Support Services. But we have lots of different departments that do that kind of work. I know the city does too, and we'd love to be a part of thinking about how we connect the dots to get people the supports and the help that they need.
Thank you.
Yeah.
Thank you.
Thank you, Commissioner Prizia. So just a couple of things I wanted to wrap up with on this. This is as good a partnership between our local institutions as we could possibly hope for. The city and the county put up the capital for this and continue to be involved kind of in an advisory support role and transportation role. What we'll talk a little bit later today about building out the Eastside Health and Economic Development Initiative and how that specifically opens up the opportunities for people in nearby neighborhoods to walk or drive quickly to you, as opposed to having to go around and make a 3-mile trip to go 100 yards. So these are things that we're specifically doing as part of the partnership, whether we realize it or not. This sort of thing doesn't happen very often, not just in our community, but nationally. We have 3 very strong institutions, and the opportunity to bring them together, not just to say we have a nice partnership, but to change and save lives in our community is a huge deal.
Yes, it is.
And we should not let that just pass by without noting that it works. It does change and save lives right here in Southeast Gainesville and across our community. I want to also point out that the city and the county were able, particularly the city, to do this. If there's a silver lining from the pandemic, it is that American Rescue Plan funds came down to us and made things like this possible. Without former President Biden signing off on to this in Congress, we would not have been able to do this, period. So I'm not going to let that slide by without making that notice to everyone. So that's a real thing. And I look forward to more partnerships with the federal government. No matter who the president is, we are open to partnerships. Once more, your hours. Let's make sure everybody's aware.
Our hours are from 10 to 8 p.m. daily and from 10 to 4 p.m. on Saturday and Sunday.
Excellent.
So
Very, very good.
we're here to serve.
All right. We appreciate you very much. Thank you for making time to come talk with us today. All right.
Thank you.
Thank you. All right, Madam Clerk.
Mr. Mayor, we're on to 2025-467 Meridian Healthcare Central Receiving Facility update with a recommendation, the Joint City County Commission. Here a presentation from Meridian Behavioral Health Care staff.
Welcome.
Good afternoon, Mr. Mayor and Commissioners. My name is Jennifer Barber. I'm a licensed mental health counselor, and I'm the director of the Central Receiving Facility at Meridian Healthcare. The Central Receiving Facility is a one-stop shop, a single access point for all individuals looking for mental health treatment or substance use services. It is for all ages. It is open 24/7, and it does not matter if you have insurance or not. So we did open on January the 6th, and since we've opened, we've been tracking all the clients who've come through, and we've kind of put together some demographic data on it, and that's what I'm here to share with you today. Oh, I'm in control of this, right? Okay. I think, Brandy, this may not be the most updated slide. Sorry. It's okay. But I'll fill in the gaps. How's that? Okay. So since we opened in January, we have served today about 1,117 clients. Sorry, this data is missing, but we started off in January at 148 clients, and we've gained momentum each month, and this is up through May, and as of May, we had served about 960 clients. This slide too is a little different to date, but what we're seeing come through the door really is an even break between Baker Acts and voluntary clients. So right now, from January to May, what we see is about 48% Baker Acts and about 48% voluntary, and then about 4% Marchman Acts. All right. The funding is pretty consistent month over month, so this slide's not going to be much different from January through May. What we see primarily is LSF funded or uninsured clients, just at under 40%, and then managed Medicaid. And then we also have a small percentage of contracted insurance, such as the Blue Cross Blue Shield, and then a very small percentage of your Medicares and insurances that we do not have contracts with. It's about 11%. The ages that we're seeing come through, it's mostly adults, so predominantly 35 to 54. The second largest group is 19 to 34. And then the third is just under 18 years old. We have a very small percentage of 65 and older, and a very small percentage of 55 to 64. For law, sorry, these are much more updated. For the law enforcement processing time, what we had hoped to see is 15 minutes or under, and what we're seeing to date is about 3 minutes. So month over month, we've been between 3 and 4 minutes for law enforcement, and that's not really varying. For our admission processing time, from the time a person walks through the door, is screened, and has a disposition, we shoot for 4 hours or under, and I know that seems lengthy, but it is a very lengthy process. And we have consistently stayed right around 4 hours, with May being just under 4. We do partner with some community hospitals. So when we have insured clients, we do share our clients with UF Health and with North Florida. For adults, it's both. For minors, it's just UF Psychiatry. Because this slide is not as up to date as I would like for it to be, I will just let you know that they're taking about 25 to 50% of the referrals that we send to them at this time. So we do have a good arrangement going on with them. And then for aftercare appointment attendance, the reason this slide is important is because we do like to see any clients that admit to our crisis stabilization unit following up with a 7-day appointment post-discharge. The idea is that would reduce the likelihood of a readmission. We have seen, with the increase of clients coming in through central receiving services and the expansion of areas that we're touching, we have seen a slight decrease in those numbers. And right now we're at about 30%. And I'm sorry, this PowerPoint is not the up-to-date one that I wanted to share, but if you have any questions, I will be happy to take them.
We do have the beginning of what I assume will be many questions.
Okay.
Commissioner Prezia.
Yeah, well, first I'll say thank you, and maybe send us the updated presentation.
Yes, I will.
And we'll look at the updated numbers. But I'm not sure that I totally understood that aftercare slide, or sort of the sort of reduction in recurrence. But I'm wondering if you do have numbers, like if you're seeing people return again, like if you're seeing return clients, folks that leave or come in crisis and then end up showing up again, either voluntarily or with law enforcement. That's my first question.
Yes, absolutely. And I'm sorry, the slide in the PowerPoint that I'm holding does have numbers like that. And so what we're seeing come through for law enforcement brought in folks, it's about 50%. And we have a high percentage of walk-ins, I'd say about 38%. The rest are referred from different community partners through our email system. We have an email referral system. And there's always a recidivism rate when it comes to behavioral health, right? I do not have the exact percentage of that rate right now. I'd be happy to get that and give it to you all. But we do have a handful of folks that we're going to continue to get. We can give them the aftercare appointments. We can provide all the resources. And for one reason or another, they're going to come back for our inpatient care.
Another question I had is, I guess it's not 100% clear to me sort of like what happens next, right? Like, so somebody shows up, they get the crisis stabilization, but what I'm being told by everybody in the know is that we don't have enough beds in this community. We don't have enough spots for people who need inpatient care. Rather, they're under the care of rather they've been incarcerated and but they are found incompetent and they need a bed. Or they're just walking in and they need a bed. And so I'm interested if you can tell me sort of with folks in this situation, like what happens next and what, if anything, is Meridian doing? And I'm glad UF Health is here and to increase the number of beds or spots that we have available for people.
So for behavioral health, like mental health specifically,
Yeah.
we're not having an issue with beds. We take all the clients who come through. Not everybody who comes to us gets admission, right? Obviously, they're screened for criteria. They may or may not need behavioral health services. We have beds. We share with UF Health. We share with North Florida. If it's an insurance that we don't take, we transfer out. We can go out to the Vines. We can go to River Point. So we're sharing with a lot of community partners. So we're not seeing a lack of beds in mental health needs. Like for substance use services, perhaps so. And typically that is around residential type services. So you have folks come in who need detoxification or withdrawal management, and they may go to withdrawal management, and then getting into a residential program with no funding can be tricky. So if Bridge House is the only one in the Gainesville area, then there's a wait list. We do try to refer out. We can put on other wait lists, but that's typically where we're seeing a shortage of beds.
Okay. I guess I'll address my colleagues and you all. I think, the reason we built this facility, right, in part, was because we saw that, one, mental health is such a big issue in our community and we were seeing the challenges of it, right? But also we're seeing that mental health cases are filling up our jail, right? And that may not be the best place for those individuals. Like they don't really necessarily belong in jail, or they're in jail because they committed a crime because they're not dealing with their mental health or substance abuse issue. And so then they're continuing to commit crimes. And so, I do think we need to get to that issue and figure that out too, because I think the central receiving facility is solving sort of one step in that process. But we're still seeing, over 30% of the people in our jail have a mental health diagnosis. And I'm sure it's not getting any better sitting in jail.
Right.
And many of them are waiting for a spot in a facility. So I don't know what the definition of that spot is, that bed is, if it is a residential substance abuse facility versus a mental health. But we're being told that, not just waiting from the state to go to a state mental institution at a state level, but even our folks are waiting for our mental health courts. They're sitting in our jail waiting for a spot to be placed. So I don't know how that fits in with our conversation, but I feel a real responsibility to we spent a lot of money on the central receiving facility to try to divert people away from our jail, right, and get them into the mental health treatment that they need. But we're not seeing so far that's completely working, because there's still a lot of people with mental health issues in our jail. And so I just would love to continue that dialogue, that conversation, to see what is going on and how we can work on the next piece of that issue. How do we begin to move that needle in the right direction, much like we are with physical health and the social determinants of health and addressing the root causes? How can we do the same thing with mental health and criminal justice?
Got it.
So happy to have that conversation offline. I'll make an appointment with you. Yeah. But I just would love to know, if we can work with our jail population manager to look at, what diagnoses, if we can get some lists and sort of look at what you all have available and why we're not finding matchups.
Okay.
Thanks.
I will say I have seen an uptick in jail referrals coming to us from the jail. So I'd be happy to, definitely take that offline with you and have a further conversation.
Very good. Thank you, Commissioner Prizzi. Commissioner Cornell.
Thank you, Mr. Mayor. I want to continue on with this discussion that Commissioner Prizzi started. This is another joint partnership that the city and the county worked on, and the legislature, I'm going to say, for 8 years. And here we are, and thank you so much for presenting this initial data, which I'm going to call it its initial data. But I do want to stress that I would like for us to have regular updates, and I would like us to be focused on getting to the point of what Commissioner Prizio mentioned, which is diversion, and getting folks the help that they need so that they aren't put into the jail and they can contribute. So I just want to verify some of the numbers you told me. So,
Okay.
1,117
Yep.
visits.
That's up to date.
50% came from law enforcement.
About 48.
And of the total, we've had about 30% of them have come multiple times. They've come once and then they've come back. 30% returned.
No, I don't have that number. That number I can get to you as far as recidivism goes for coming back through the facility.
Yeah.
I can
I'm
get that.
curious about that number.
Okay.
And I'm also curious of those that came from law enforcement. Did they do what we had really thought and built this facility designed to do, which is they didn't go to jail, they got help, and they are now on either case management or they are stabilized in our community. Second question, how many of those that came are insured?
How many are insured?
Yeah, how many have insurance?
It's about 20% right now that has private funding of some sort.
And is that why the referrals are so low? 25 to 50% are being accepted because the hospitals are only accepting those with insurance?
Of those, 20% is what we're referring to the partner hospitals and sharing. So we're admitting a disproportionate number of those clients, right? Like all of the clients total, but we're only sharing the 20% that are funded. We have not gotten to a place where we've had to rotate out uninsured people because we constantly have those beds available, if that's making sense.
Yeah. Okay. And the other thing we had talked about was kind of what Commissioner Chestnut brought up in the last presentation, kind of an advisory board made up of law enforcement, the hospitals, the community, the county, the city. Where are we on that?
We meet quarterly as
You
an
meet quarterly.
advisory council. Yes, sir.
And are there like minutes taken? Is that a mechanism by which that group can provide data to these two boards about the effectiveness of what's happening and how we can work on improving the outcomes?
Yes, we can definitely get the minutes. So far, we've had one since opening, and I shared a version of this data, and that is probably what we're going to share in the following month is a continuation of this data that folks have been interested in. I would like to see more about how we're working with the jails, as has been suggested here, and try to get some more information on that as well.
Okay, last question, Mr. Mayor. Of those that were admitted, how many of them were unhoused or homeless?
That is a number I will have to get back with you on. I'm sorry, I don't have that off the top of my head, but it's a pretty significant portion that's coming to us.
Yeah, I know. So the city does the shelter and the county is attempting to do housing. And so this is kind of another area where we need to be, in my opinion, connecting the dots of those that are homeless or unhoused, what's happening. Like, are they getting into housing? Are they going back to the shelter? Like what's happening? So thank you for the first presentation.
You're welcome.
Probably more questions than you anticipated, but to Commissioner Prizio's point, now that it's built, I think our real focus has to be, are we achieving the goals that we set out to achieve to build it? So thank you so much.
Of course.
Thank you, Commissioner Cornell. Commissioner Alford.
Thank you for your presentation. I spoke at the ribbon cutting, I guess, or the groundbreaking, I can't remember which one it was, and talked about the fact that until we have enough housing, we're going to continue to have a problem because unless we address the social determinants of mental health, which are pretty much the same as the social determinants of health, we're not going to be able to solve this problem because if people are released out onto the street having to manage their own medications, which is access to medication, another problem, and being able to hold on to it on the street.
Right.
There's just so many contributing factors to your success that are outside of your control, I feel like. And so some of those are things that we are working on as a commission. And I think it would be super helpful if we could track some of those social determinants that would be useful statistics for us, such as how many folks come through your doors that are unhoused, how many are recently released from jail, how many are compliant or non-compliant on their medication, and why? Is it because they don't have insurance, they don't have the money to get it, or they don't have access to the medication, they can't hold on to their medication? You know what I'm saying?
Yeah.
There are just things like that that I think would be useful to us to know, and I was curious if that would be within your purview to track some of that type of data to help us help you.
It absolutely would be. And as you're speaking, I'm thinking about all the different things that we track in all the different places, because all those things are available, but just in different places. And so I can definitely start looking at how to access that information easily.
Yeah, because I feel like the success of this facility is going to be greatly predicated on those support systems, that not just reducing recidivism, but increasing access to housing of any sort, and I think funding for a lot of programs is at risk right now, and being able to track that impact, I think, is going to be important. So thank you. I really appreciate it, and I look forward to, like Commissioner Prizia, further discussions.
Very good. Thank you, Commissioner Alford. Commissioner Prizia.
Just my colleagues, thank you, City, for our patience, but I do think this is an important conversation, even, in terms of like the big picture of our permanent supportive housing versus your sheltering too. And I will say, I think, one thing that I've realized in kind of tracking some of these conversations in the community and what I'm trying to understand the data here is that I think that both with our reentry program and with this program, we're going to have to dedicate more resources to permanent supportive housing that's connected to these services, because right now, the way that all of that process goes is through the continuum of care. And the way that Ms. Tuck is here and she can correct me if I'm wrong, but my understanding is that in order to be on that list, you actually have to be homeless, which means that you have to have fallen into homelessness. So if you are coming from the jail, you're not considered homeless. You were in the jail if you're in the jail for more than a certain number of days. So you're no longer considered homeless because you were, quote, living in the jail, I guess. And then you fall into homelessness, and then you get on the list. And I know the list is sort of prioritized based on need and everything, but you just got out of jail. You were probably stabilized on your medication while you were there. You were in a place where you've served your time, you're ready to be a productive member of society, ideally again, right? But you have to fall into homelessness and live in homelessness for some period of time before you're going to climb that list enough to potentially find housing. And then we don't even have enough permanent supportive housing for that person. So we're just setting that person up for failure and recidivism, because if they are destabilized on their meds again, they stop having their meds again, they don't have a place to live, they can't work on getting a job, like all the things. And so while I love that we're working with our current permanent supportive housing that we're building and that we're doing through the continuum of care, I think there's a real need for us to consider how we work on the construction of some permanent supportive housing that would be dedicated to reentry and the central receiving facility, so that we would have the opportunity for those programs to be more successful and to have dedicated housing resources. That's like a big picture conversation, but it's one I wanted everyone to hear, because it's not going to be a small challenge to find the funding to do that. But I think there's probably grant funding out there, and where there's a will, there's a way.
Very good. Thank you, Commissioner Prizia. Commissioner Wheeler.
Just very quickly, how many people do you all house at the lodge, and what are the requirements for that housing?
The lodge is a very separate program for me. Okay. I would definitely be able to get that information from you. And I did recently have some communication with the lady at the lodge, and one of the requirements is that they do have to be sober.
They do
have to be sober
I see.
to stay at the lodge. So a lot of times what's happening is folks are going through our Bridge House program and then housing at the lodge afterwards. And I believe it is a 90-day max, is what I was learning. We do not send a lot of folks from the central receiving facility to the lodge, because typically folks coming through our care are in some sort of crisis, and so they're going on to services from there. I have not come across folks in need of housing and that being their primary problem for coming to our unit so far. But I can find out total numbers for the lodge for you.
No, that's all right. I just remembered that we were talking about beds.
Yes.
And I know that Meridian has been really wonderful about offering bids to some
Yes.
of the folks that we've referred over there too.
They absolutely will. The lady who runs it's lovely, and if she can help, she absolutely will.
Thank you. Thank you, Mr. Mayor.
Thank you, Commissioner Wheeler. Commissioner Willets.
Mayor. Just because it's been a while, the spring has been flying by. I know that Lutheran Services or Lutheran Family Services or Lutheran Services Florida, I forget which one, large chunk of funding that really helps. The federal administration has been a little skeptical of the good work you and others do. I applaud you and thank Lutheran Family Services and Lutheran Services of Florida for all the work they do in all the communities. Are there any issues about funding drying up? Like, kind of what's the current status? Because we're talking kind of long-term solutions about this. I kind of want to know, is it that there's going to be a hole in funding in our community of a vital service?
Not that I'm aware of so far. So far, all of our funding is the same as it has been since we opened. Again, it's a relatively new program, so we haven't had to shut down anything, or we haven't lost any positions so far. The end of the fiscal year is the end of this month, and we're projected to continue just as we have been.
Okay, thank you. Because there's a lot of people in our community say things like, "Oh, we should support veterans or homeless people," or there's a lot of people say we should support, and then in the same time they don't understand that federal governments that go down to different organizations do a lot of the work and keep the organizations doing the good work. So this is just a way for me to thank you and congratulate you on the good work you do, and to tell people to talk to their federal representatives because DOGE is a threat to the good work you do in our community, and I appreciate it. Thank you. Thank you, Mr. Mayor.
Thank you, Commissioner Willets. Commissioner Cornell.
Real quick, Mr. Mayor, just to follow up on a question I heard. I thought I heard Commissioner Wheeler ask about housing, and I thought when I asked you what percentage of the folks were homeless or unhoused, you said 80%. Did I mishear
No,
that?
I don't have a percentage on.
Okay, so I misheard
folks.
that.
Yes.
Okay.
I don't have a percentage.
So we don't know what percentage of the 1,117 are homeless or unhoused.
No, I do not have that off the top of my
Yeah,
head.
that would be an important thing for the advisory board to report back to us, to connect the dots to what Commissioner Prizio was kind of mentioning. So thank you. Thank you, Mr. Mayor.
Thank you, Commissioner Cornell. So I want to tie a few things together here and give some kudos to some folks. In addition to the central receiving facility, a thing that we have been doing in this community that is fairly rare around the state and probably around the nation is the existence of co-responder units. And we talk about that every now and then. We have updates on it. But we are now up to a point where we have a total, and I'm going to get this wrong probably, but I think it's 9 units. I thought it was 6 or 7. I think it's up to 9 now. Between, well, and UF has 2.
Oh, UFS 2.
Yeah, they have 1 or 2. Right. I think we currently have an active 9 co-responder units across the community. And that is an officer who is trained to respond to mental health situations when they go out on a call. But riding with them is usually someone from Meridian, not exclusively, but it's generally been a Meridian co-assignment, riding with that officer to make sure that if a call is a mental health call, that there are trained professionals who can deal with it, instead of the idea that we'll think crime first. It is often not a criminal activity. It is often someone who needs the specific help that you all are trained to offer. So having the central receiving facility working in tandem institutionally with the co-responder units through GPD, through Alachua Sheriff's Office, and through the University of Florida Police, give someone a real opportunity to not just go to jail,
right,
but to get help and come out of this in a better place than they went in. And I want to give a shout out, since I talked about the American Rescue Plan. I want to give equal time and thank the legislature, the Florida legislature, for work they've been doing on this issue as well, specifically our own Senator Jennifer Bradley and the Tristan Murphy Act and some of the other things that she has been working on to try to make sense of what is a particularly horrific situation once someone with a mental health issue is put into the prison system. Bad things happen. And she is particularly interested in working on very passionately ways to fix that. And some of the things that we are doing here in Gainesville and Alachua County help move that forward. So I want to thank everyone who is working toward that end. And I don't want this to sound like it is all doom and gloom, because we are right here in our community at the forefront of making good things happen with that. Commissioner Prizia.
I just want to respond to that, and I think it's something that, and again, I don't ever want to throw cold water on a thing, but the correspondent teams are the most amazing things, I think, that we've done in a long time. We have 6 staffed. We do have 9 technically funded, but we can't find the clinicians because it's a really hard job. And so I think it's an opportunity, again, it's an opportunity, not a challenge, but, it's an opportunity for workforce development. Maybe Career Source works with UF and their psychiatry department and recruiting people, or Santa Fe with certification programs, but it's definitely a need. We in all of our public safety realm, we have needs around this, but this is a big one. The clinicians, they haven't been able to place clinicians with a couple of those teams. So there is a need, and if anybody out there is a clinician and interested in working in the community, we have positions available. So
thank you, Commissioner Prizia. Commissioner Engel.
While we were handing out kudos, I was also wanted to throw Gainesville Fire Rescue in there with the ability they've got to cover some of those gaps and help people get their medications when they're not available, and their mobile pharmacy. Forget the actual name of the program. There's the community paramedics program, and there's the gap coverage that I can't remember the name of.
But that's community resource paramedicine, actually.
And a lot of times I feel like we're really fighting these kind of national and state level issues and trying to address some of these local actions. And I'm really impressed with what we've been able to do as a community with, how much more our park service does than just parks, and how much more our fire service does than just fires. And we're not able to solve these problems because these are large societal problems, and we're doing our best to mitigate some of them. But I think we've taken some really impressive steps forward. And like you said, I just want to make sure we're not just all doom and gloom on this. I think we've done a lot, and we should be proud of some of that.
Excellent. Thank you, Commissioner Engel. Madam Clerk, do we have any public comment on this?
No public comment, Mr. Mayor.
Very good. And it doesn't look like we have any action to be taken here. I see no photo lights, so thank you very much for your time.
Thank you.
And thanks, everyone, for your attention on this. Madam Clerk.
Mr. Mayor, we're on to 2025-479 Hoggetowne Medieval Fair presentation with the recommendation, the Joint City-County Commission hear a presentation from Parks, Recreation, and Cultural Affairs and consider a jointly sponsored city-county partnership for the Depot Park-based free event in fiscal year 2026 and seek other funding sources such as city-county partnership for a permanent festival and arts park.
Very good. Thank you. Welcome.
Hello, Mayor, Commissioners. I'm Leslie Ladendorf. I'm Assistant Director for Parks, Recreation, and Cultural Affairs, and I'm happy to be here with our team to present some information and the history of the Hoggetowne Medieval Fair and where we're at now and where we need to go in the future. I'm going to introduce our manager is Carol Velasquez Richardson, and we also have Sunshine Andre, also known as Sunny, who is our Assistant Manager for Cultural Affairs, and they're going to do the presentation for you.
Thank you.
Hello, Mayor, Commissioner, City Manager, County Manager. It's my pleasure to be here on behalf of Parks, Recreation, and Cultural Affairs. And the best way to do this presentation is to bring up our Assistant Manager, but who's also been part of the Hoggetowne Medieval Fair for 19 years. So she has passion. She knows this story. So we're going to introduce to you Sunny Andre. And I also have another team member who didn't want to speak, but she's here to support with Miss Lily Zhao.
Thank you.
Good afternoon, Mayor, Commissioners. Thank you so much for having us. One quick correction, I've actually been a part of the Hoggetowne Medieval Fair for 30 years. I started when I was 19. And it has been my honor to produce this event now for the past 9 years. So the information I'm going to share is basically an overview of those past 9 years, including a little bit of history. For those that attended the meeting several weeks ago, this is going to sound very familiar as I have scripted the whole thing, because if I go off book, this becomes a much longer meeting. And I got the right button. All right, so the Hoggetowne Medieval Fair began at the Thomas Center, where it was held for 4 years before moving to the Alachua County Fairgrounds. During the pandemic, it shifted to a virtual event called Hoggetowne at Home. And then after the sale of the fairgrounds, the event relocated to a private property on Archer Road, formerly known as the YMCA complex, sports complex. For the past 2 years, it has taken place at Depot Park. So a quick bit of history. The Hoggetowne Medieval Fair began in 1987, founded by the Society for Creative Anachronism, or the SCA. A few years later, the Cultural Affairs Office took over the management, but the SCA remained an integral part of the fair, continuing to provide medieval demonstrations each year as it continues today. As the fair expanded, it quickly outgrew the Thomas Center and moved to the Alachua County Fairgrounds. Then by 2000, record-breaking attendance led to an addition of a second weekend, and then in 2020, the event had grown enough to necessitate adding a third weekend. After the pandemic, returning to in-person events came with the challenge of securing a new site. We were fortunate to find a temporary home at the old YMCA Sports Complex on Archer Road, but in 2023, another surge in attendance forced us to search for a new space that would accommodate the increase in traffic. Staff spent months working on securing a new location, but despite the efforts, each potential site ultimately fell through. With no viable option available, the fair had to adapt once more, shifting to a single weekend at Depot Park. For the past 2 years, we've made Depot Park our home, and while it's been wonderful to keep the event alive, we can't ignore what we've lost in the process. To adapt to the smaller space, we had to reduce the merchant marketplace, as well as scale back to 6 stages of entertainment, which resulted in losing the excitement of the joust and the wonderful birds of prey demonstrations. The single weekend schedule has meant saying goodbye to fan favorite performers such as Barely Balanced and the cherished activities like medieval games. A quick snapshot of our yearly attendance. Attendance over the years has seen a general climb, with weather issues, a pandemic, and locations causing dips. So you'll see in 2017 we had great weather. In 2018 and 19 we had rain days that caused a drop in the attendance there. We went to 3 weekends in 2020, so that was a spike of attendance. And then in 2021 we went virtual and only had 8,000 unique viewers to our Hoggetowne at Home virtual experience. In 2022, we relocated. We saw a spike in attendance in 2023 since we were in the same location. In 2024, we changed locations again, thus the dip, and then we're back up to 2025 with close to 50,000 attendees for that event. So because planning for this large event takes about a year, expenses for each event is split between 2 fiscal years. So the event team watches the budget carefully to ensure that expenses do not exceed the anticipated revenue. Since the majority of the revenue comes from the ticket sales, weather plays a crucial role, so you can kind of see that rise and fall here within that revenue. Quick expense breakdown. So the expenses are spread throughout a variety of needs, with the majority coming from entertainment, equipment rentals, and services. Miscellaneous fees here is processing fees associated with revenue transactions. The staff expense listed here does not include staff time that is used for planning, but just for the staffing over the weekends of the events. Because we have staff that work on multiple events throughout the year, it would be difficult to determine the number of hours focused on just a single event. But it does include additional staffing such as EMS, GPD, or ASO, depending on which jurisdiction we're in, as well as temporary staff. So up until recently, the Hoggetowne Medieval Fair has been a self-sustaining event, with the funding primarily coming from ticket sales. The only expense that the general fund has covered is the staff time spent on planning the event. The strategy has worked well over the years. When the event was able to restrict entrance based on tickets, it has become necessary, it provided the necessary funding to allow the event to grow organically and then adjust where that growth was needed. Before the pandemic and all the different location changes, the Hoggetowne Medieval Fair featured 150 merchants, entertained guests on 11 stages, including the joust, worked with over 150 volunteers, many of whom returned to the volunteer year after year, and welcomed over 2,000 students across 27 counties for school day as part of our low-cost field trip program. Our dream would be to find a location where we are able to host a large event and see all of these features return. To return to a large event like what was previously held at the Alachua County Fairgrounds, we would need at least 47.5 acres that gets divided up into parking, merchant booths, games, rides and activities, 11 stages of entertainment, and participant camping, as well as management space for things such as ticket booths, dumpsters, generators, and other behind-the-scenes necessities. It is also important to have some open green space where people can spread out from the crowd. This is the minimum needed to sustain what we had and does not provide an opportunity for future growth. If we wanted to be able to grow, we would need 60 to 80 acres for expansion. So to host the large 3-weekend event, 60 acres of flat, dry, mostly cleared land. The bulk of this need is the 30 to 40 acres, which is cleared for parking and preferably not used to produce plants like watermelons, which can create a very bumpy, very interesting path when people are driving it. Because the event is produced by the city of Gainesville and staff must travel to and from the event location on a daily basis, sometimes multiple times a day, the site must also be within 4 miles of the city of Gainesville city limits. This location also needs to come within budget for the site rental costs, of course. So time-wise, we need the space for the entire month of January. It's a 2-week setup, a 5-day tear down. The event runs for 3 weekends and then stays up throughout the weeks during those weekends. So it really does take over the entire month to get everything done. And then for vehicle access, to reduce roadway traffic congestion, as we all know was an issue back in 2023, we ideally would have 2 main access points so that traffic can continue to flow and we are not blocking off the roadway. The guest access ideally would be off of a 4-lane highway so the traffic can flow through. And then the secondary access would be for emergency vehicles, staff vehicles, deliveries, and so forth that take place during the day, during the event day. So site needs infrastructure. Water is, of course, at the top of our list. Water is crucial for food vendor booths and for our animal performers. Ideally, there would be either utility-provided water or a well that has drinkable water. And it would be able to reach every location that we needed it to within the site for both our food vendors and our animal performers. Power is secondary. We need at least enough amperage to support 15 food vendor booths at roughly 30 amps per booth, with additional power for ticket booths, several stages, a shower trailer, as well as some access for different artisan booths. We were able to overcome this challenge when we were at the YMCA Sports Complex, but it does come with additional expenses and limitations. And then fencing, perimeter fencing so that we can prevent unauthorized access, which gives us the ability to make sure that it is a ticketed event. No one is getting in that does not have permission to get in. Ideally, it would be around the entire site, but at least around the programmable site would suffice. We can solve the challenge with temporary fencing, but again, it comes with an additional cost as well as an additional time added to it for setup. So some additional desired features, these are niceties. Flushable toilets, always nice. Patrons appreciate that. We can deal with porta potties when we have to, but if that is an option, it's always preferred. A campground for our vendors. A lot of our vendors and performers travel the Renaissance circuit, so they travel around the country throughout the year, and they need a place to stay when they come to Gainesville. A lot of them like to live on site so that they are close to their merchandise. If they do have travel with animals, their animals might stay with them. A tree perimeter. So at least along the west side to help block the strong winter winds, which gets very gusty, can be very gusty in January. And then a paved trail / road, which would enhance ADA access and give us the ability for EMS to move around the site quickly to address any needs that might take place. So why 4 miles? We often get the question, why 4 miles? So in regard to these location requirements, So briefly explain, it takes the cooperation of several teams to set up and take down all of the sets and props for this event. The majority of the work falls on our park staff and their team of about 10 to 12 people, sometimes a little bit more, who work 5 to 7 full days preparing the event site. During this time, they are unable to fill their daily duties maintaining city parks. An event too far from Gainesville would mean additional drive time, which would result in additional setup days due to the time lost from traveling to and from the location. And in addition to this challenge, costs would go up for staff overtime expenses incurred during the event weekends due to the travel back and forth to a distant location. While there is revenue generated from the fair, it is the economic impact from local and out-of-county tourism that has the largest effect on the city of Gainesville. If the medieval fair were to relocate further than 4 miles, the economic impact would shift to the county or another municipality, and the city of Gainesville would lose the benefits of producing the event. So over the past 7 years, staff has evaluated more than 40 potential locations in the search for a new site. In the next few slides, we will review some of the most frequently suggested properties and outline the reasons why these sites are not considered viable options. So the Old County Fairgrounds, previously by the airport, each year we're asked, when will the fair go back to the fairgrounds? To answer that, the property is now controlled by the Army Reserve. 99 years. And the development to convert the property into an equipment concentration site is nearing completion, according to an article published by WFT on March 27th, and it is expected to open in September. So the Alachua County Agricultural and Equestrian Center. So staff explored the possibility of using this property, and based on the map imagery, which you can kind of see in the black shaded, gray shaded areas, we determined that the potential usable space of the property was approximately 18 acres, which is too small to meet the needs for the medieval fair. So the West End Golf Course, staff explored this as a possibility. It was acquired by Alachua County and be a county managed park. Thank you. The current plans for the space do not include enough parking for 4,000 vehicles, which is what is needed for the medieval fair. The Gainesville Raceway. The team was excited to explore the Gainesville Raceway as a possible solution. It meets the minimum requirements for space, including parking and fencing. It would even provide large paved lanes to make easy access for wheelchair and scooters. Although it doesn't include power and water, which are high costs to bring in those temporary solutions, those would be solutions that we could outsource. So we did feel that this could be a viable site. During the negotiations, the requirements for insurance coverage became too extensive, and the insurance company that we were working with through the city's risk department told us that they would not be able to provide us a policy for this event. No. We visited the Cusquilla Nature Center, beautiful property, but its usable space only adds up to approximately 16 acres and therefore would not fit the space needs for the medieval fair. We considered the MLK Center as a possible location as it has enough acreage for the program space for the full event, which is approximately 11 acres, but it was discovered that there's no closed parking pockets. And we determined that the traffic impact to the neighborhoods and the neighbors living around the center would be too great for this to be a viable location. This property is located on Waldo Road. It's directly across from the airport. Many people drive by, see a big open space, and they go, why don't you go there? So we looked into it, and we discovered that the FAA sound restrictions on decibels near or in the flight path of the aircraft and the proximity and positioning of the site to the Gainesville Regional Airport prevent this space from being utilized. That sentence is a mouthful. That's why I wrote it down. All right, in 2018, staff held community engagement meetings and developed concept designs exploring the potential uses for the property owned and undergoing restoration by Coppers. One of the concepts included the possibility of transforming the site into a festival and arts park. However, several other concept designs were presented during this process, so it's unclear whether the particular idea would have gained any significant momentum. Subsequent challenges, including the onset of the pandemic, the departure of the assistant city manager who was leading the effort, and the ongoing restoration, have left the timeline for this particular option uncertain. And then we got close. In 2023, the staff moved to purchase 3 parcels owned by the Birch family that were located between Waldo Road and Northeast 39th, totaling $1.5 million. Although there were some sections in the floodplain, which is indicated there in the pink, there's enough space to meet all of the minimum needs and plenty of space for future growth. The owner was initially interested, but unwilling to include a zoning clause in the contract, which had been required by the city, stating that the sale of the property would be contingent on receiving the necessary zoning for the property to be able to host a festival and arts park. So the owner decided to go with another buyer. That buyer turned around and offered the property for $10 million. A recent update is showing that they are now offering number 91 for $4.5 million and number 46 for $3.1 million. So it's come down a little bit, but is still over $7 million for the 2 parcels. So some of the other properties that we explored, these are not, it's not an extensive list, it is not a complete list, but it is a highlight on some of the other things that we have looked at. So Carson Springs Wildlife, which was approximately 12 miles from Gainesville, Peanut Patch and Corn Maze, which is no longer in existence. There is property on Hawthorne Road we explored, some property in Newberry, Waldo, and then several city-owned property parks that we explored that were all considered unviable for one reason or another. So what's next? As we look towards the future of the Hoggetowne Medieval Fair and knowing the challenges we've encountered finding a location for the large 3-weekend event, the question we're trying to solve is, what's next? Do we try to continue a single weekend at Depot Park? Is there a property we just haven't discovered yet? Are there partnerships that could be established? And so for 2026, we will return to Depot Park. It's a beautiful city park with paved pathways that make it accessible for wheelchairs and scooters. However, its small size and limited parking create challenges. Many eager attendees arrive only to find parking's already long or non-existent, very long food lines and crowded lanes. And then hosting the event for this single weekend compresses an audience that would normally spread over the course of 7 days to 2 days. So it does make for a very busy, active park over that single weekend. The other challenge it brings is we are not able to fence it in, so we are not able to collect ticket fees, which is how this event sustains itself. And therefore, we will need additional support in order for this event to continue. So in summary, since the closure of the former Alachua County Fairgrounds off of Waldo Road, the Hoggetowne Medieval Fair has not been able to secure a site that meets its long-term needs or supports return to its traditional 3-weekend format. In addition, efforts to establish a permanent festival and arts park have been delayed due to rising property values and increasing construction costs. Without funding from the City Commission and other partners, the Hoggetowne Medieval Fair will be unable to continue as a city-produced event. So while we continue to search for a viable location for the 3-weekend event, funding in the amount of $130,000 will need to be secured to support an additional year at Depot Park. Staff is recommending the consideration of a joint sponsored city-county partnership for the Depot Park free event in 2026, as well as seeking other funding sources such as a city-county partnership for a permanent festival and arts park. Thank you.
Very good, thank you. We do have some lights to start, and I'm sure we'll have more. Commissioner Cornell.
Thank you, Mr. Mayor. I love the medieval fair.
So do I.
And to my city commissioners, holy cow, I see you guys have spent a lot of time and effort trying to find some solutions. So I had no idea of the history and the amount of work that you had done. Can you go to the attendance slide, please? So I know we are putting this on I guess we're putting this on the joint agenda because we're both looking at kind of budget constraints in this upcoming budget year. And so we're looking for funding sources. When I look at that, what I see is the most successful attendance we've ever had was last year at Depot Park. What I would do if I were city commissioner is I'd fence it, I'd charge $10, I'd raise $500,000. and I'd have some money, and then long-term, I'd try to get it done at Cabot Coppers. I think Cabot Coppers, to me, of all the things that you talked about, and I remember my dear friend, the mayor, and I working on Cabot Coppers when we were attempting to make that a fairground. This was one of the primary things that we thought about the medieval fair. And if we charged $10, had 50,000 people, we'd raise $500,000. That would give us a couple of years of funding, 3, to give us time to come up with a long-term solution. And I think having it in the city is important. I think having it all the way out at the fairgrounds that were in Newberry is too far. I do think that showing the success of that attendance on 5 acres I understand the need to have 20 acres, I get it, but maybe it doesn't have to be that big, and if it doesn't have to be that big, that may open up more sites. I love the idea of it being on the corner of 8th and Waldo, in a 5-acre parcel or something like that. I don't know, I'm out of my lane here, this is a city commissioner thing, but that's what I would do. I would fence it for the weekend, like we did with some other things that I've seen at Depot Park. I'd charge admission. I'd pay $20, but I think $10 is reasonable. Raise a bunch of money for the next 3 years, and then my suggestion would be long-term at Cabot Coppers. Thank you, Mr. Mayor.
Thank you, Commissioner Cordell. Let me add, too, that the biggest reason that we're doing this today, and we've seen this all at the City Commission before, is because I know y'all are going to get asked questions about this, and you deserve to have the information available to you to tell the story out there. So, all right, Commissioner Aprizia.
So I push that button thinking it's my mic because ours is the same. Sorry. I guess I'm confused, a little bit by numbers. I guess I'm totally down. Let's fence Depot Park. We'll help sponsor it. We'll split the revenue. We'll find a place that we can put that revenue towards in terms of purchasing. Yeah. No, but I'm saying if we split the cost, we split the revenue. But no, but I mean, really, truly, I know we already put money towards this. I love this event as well. I don't think I'm in agreement that it needs to be in the city. I've never understood the 4-mile rule. I've been told that a bunch of times when we were looking for places, and I just don't understand it. I also don't understand if you can do it at Depot Park, then you could do it at the fairgrounds. And the fairgrounds are way bigger than Depot Park. And we have 2,000 seat arena. We have stalls for horses. We have stalls for other animals undercover. We have 52 RV hookups. We have a ticket office. I mean, we have all the things set up there for that event to be a success there, way more successful. And we can close it off and we can fence it and we can charge admission. It could go for 3 weeks. It wouldn't be your dream and it wouldn't have all of the parking in the 35 acres, but we could probably rent a field. And I heard you say watermelons and bumpy. Well, we can plow a field. I know at least 5 farmers with a good old tractor and a compress that they can press that ground down, and we'd have a flat field for parking that I'm sure we could lease from somebody in Newberry. So have some shuttles, I mean, these problems are solvable, and I guess I just, if we can solve it with 11 acres at Depot Park, then I would imagine we could solve it with the 30 plus acres that we have at the fairgrounds. And that's just my feeling is I feel like there's this idea that that's a non-starter because it's outside of town. And I guess I just, we made a major investment in that facility in part because it has all the ability to host animals and all of those things. And so I guess just writing it off feels like it's short-sighted, I think, in terms of an opportunity. If we don't want to purchase, if you all don't want to purchase Cabot Coppers, that is. And I know that was a conversation I tracked back in the day when we were originally going down that path, and I kind of understand some of the reasons it got derailed. But that I feel like it's a good solution, and it would give you guys the 3 weekends and the revenue opportunities that would hopefully create some positive black boxes on your spreadsheet so that we could put money towards a long-term property.
Thank you, Commissioner Prizzi. And let me clear up just a couple things. First of all, Newberry's a good long way from where most of Gainesville is. You're talking about 10 miles from the city limits, not from central Gainesville. And it is a city of Gainesville event. That's the whole point. It's not if it's a county event, that's a whole different story. But we write the check and have written the check for it. To put it somewhere halfway to Levy County is hard to make sense of. I know, and y'all are county commissioners, and I understand why that makes sense to you, but we don't, I mean, y'all aren't going to put an event in Marion County that's an Alachua County event, probably. So we are unlikely to put an event in another, literally in another city that is our event, probably. Also, let's talk about Cabot Coppers real quick, because that's going to keep coming back up. Cabot Coppers is something that is not going to become available to the city of Gainesville or anybody else until the EPA decides to push. And I will let you think through that process. It is a federal agency that is not a particularly well-funded or well-thought-of federal agency at this point. It's not going to happen until then. So we don't have leverage at the city of Gainesville, and I don't think at Alachua County, to force Beezer East, the current owner, will say, to make a final determination and spend the final money to get that to a point where it can be usable for anything, because it is a Superfund site. And until the EPA gives that last push, that's just not. It's a great idea, and it's 100 acres in central Gainesville, and we would all love to have access to it, but we don't have access to it. And when that happens, it'll happen pretty quickly, but we don't have any capacity to make it happen, as wonderful as it would be. Yes. Beg your pardon? Barely. We all want Cabot Coppers to be a thing, and I think wonderful things will happen when that does get cleaned up, but the last measure is just not something we have control over locally. So even at the state level, I don't think there's any capacity to make that happen. So.
Well, and I guess I'll just put to that, I totally understand why you wouldn't want to have it Newberry long term. I totally understand why the fairgrounds are not an ideal location long term. Neither was the Archer Road location, and neither is Depot Park. All I'm saying is that the county could offer a facility, that has a lot more amenities than Depot Park has, that accommodate what you all need for a temporary solution that is fencible, so you could make your revenue, so you could begin generating that revenue again while you're looking for that permanent location. That's all I'm saying. I'm not saying for a permanent. I agree with you. It should be here close by, because that's kind of part of but right now it's just you all are looking for a spot, and I guess I just feel like the analysis, I think most of the properties, you're right, Cuskawilla would never work. We know the parking, and a lot of it's wet, but the fairgrounds feel like it could be a temporary fix if you're willing to reopen that conversation.
Thank you, Commissioner Prizia. Let's see. Commissioner Wheeler.
Thank you. I remember you from 30 years ago.
I remember you too.
Yes, as a matter of fact, I see the Royal Highnesses in the back there too that I remember from 30 years ago. No, my first show at Gainesville Community Playhouse was Camelot. And I remember years after that seeing a lot of those costumes that I had built in the medieval fair from year to year to year. Right, absolutely. So I go way back with you, but I appreciate you all taking the time to address the reasons why you could not put the fair in all of those places like Coppers and the airport. I still am not sure about the airport property as to why that not would be able to use, then the Waldo Motorsports, all of those are things that I had asked about for sure. But in terms of the airport, tell me again, what is the reason that you could not use, because that's a large piece of very flat land.
So there are FAA rules about housing people or putting people into certain spaces where there are certain decibel levels. And because we'd have to actually camp people on the property, even if we move them off property, just having our visitors on that property, we're not allowed to. It's also in the flight path. So if you noticed on that map, you see the runways, and they do not and will not allow us to have a whole event set up at the base of that flight path, because it could be a danger if something were to go wrong.
I see.
So it's just not a great area for that. We also have to cut all those trees down. We just recently did that. If you'd noticed on 39th and Waldo, we had to cut a lot of trees down for that flight path. So they're very strict on that piece of property.
I don't know, is that the field across from there? Because there are no trees on there except the periphery, which is what you were saying you needed.
Right, we cut down a bunch of trees around that area for the airport. We have to keep it clear.
I say even because when we were working with the tourism board, Aaron from the airport had told us, that the city could use that land, that there was property there on the airport that the city could use. And I'm trying to understand, even for 12 days or how many, it's 9 days of actually operation, but I understand their setup times and all that sort of thing, that would include additional days. But out of the year, out of 365 days, that you would only be using it, maybe 20?
There's airport property we are allowed to use, and it's adjacent to the runway. It's where we would actually had our overflow parking and our other gate that would come in, and we're allowed to use that land. We're not allowed to use the land that's directly across from the runway.
On the road, okay.
Across from Waldo on the road.
Okay, and when you are looking for land like this, are you looking to put up permanent structures then that would be there from year to year to year?
Yes, and this would be a festival and arts park is what we would be building. It wouldn't just be for the Hoggetowne Medieval Fair. It would be a revenue generating, hopefully, site to have all of those really big events that need that kind of space and that kind of parking adjacent. One of the issues we do have with parking is Gainesville doesn't have any kind of charter services to run buses back and forth. We're not allowed to use RTS. And there's a vendor in town that does have buses. It's extremely cost prohibitive. We've looked into it multiple times to try to have a site where we have the fair in one place and parking farther away. We'd have to go out of town and get bids for out of town vendors to do that. And we already have to do that for parking services because we also don't have a parking services vendor in the city. And so those things kind of add to the costs drastically. So those are some of those things that we've looked into over time.
Well, I appreciate you all taking the time to explain that because I've just been frantically trying to help, find a place to make sure that we have this go. I mean, I really have, fussed real hard about coppers, which I still don't understand why we don't have some leverage because it's right in the middle of our community that's unusable when we really need it. So maybe we can find some folks who would be listening that would help us do that. But at the same time, I'm confused as to why you would not want to. I mean, we fenced off the area around the Bo Diddley Plaza when we have the big music events, right? Don't we do that?
For Fest,
Yeah, for that one. And then I think we were going to be doing that for the Tom Petty concert at one point. I mean, so it's not unreasonable that it can be done, right?
Yeah. Mayor, Chair, Commissioners, I'm Roxy Gonzalez, Director of the Parks, Recreation, and Cultural Affairs Department. It's not unreasonable. Now, there's certain things with Depot Park and in relation to this medieval fair. There's at Depot Park currently, the attendance for one, and why it's so high is that it's free, right? People can come and go without having to pay unless they want to stop at a vendor and purchase stuff. So it's free. We're going to get more people for that. Closing off Depot Park to make it a medieval fair, we need to make it medieval fair themed, right? Which entails staking tents down. Well, we can't do that at Depot Park. It's a brownfield. So we have to keep that soil, a 2-foot cap soil, clean for safety measures. So that prohibits that element of the medieval fair. It takes the integrity of the medieval fair away. One. Two is we would have to close Depot Park not just for that event, it would be for the whole month.
Oh, okay.
So we're now prohibiting the public from utilizing Depot Park for the whole month. And those are the things that we take under consideration, saying, where do we land with that? And are we guaranteeing the same amount of participants at that point?
I see, and you're also cutting back on the events that are happening within the park, so, I got it.
Exactly.
No, I got it. Where do people park is what I want to know. That's the last question I have for you. Where the heck do people park in order to get to the medieval fair?
That was the big question that we had too when we decided to shift to Depot Park. And that's why we have the term parking pockets. So there's a pocket of 300 spaces in the old RTS lot. There's a pocket of like 30 to 50, depending on how well they park, next to GRU. And then there's another smaller lot, maybe 20 to 30 parking spaces just across the street from GRU. Then we have the 2 downtown garages. So we run shuttles from the event side to the garages so that people can utilize those. We've seen a ton of people that just walk in down along Depot Avenue, and they're walking into the event. People have been parking like out in, even as far as like the duck pond area, and then walking into the event, or walking to one of those shuttle places and then coming in. So we've identified several on our website for out of town people that don't know the area, and then people that are residents that are used to frequenting downtown. They've all figured out like their spaces, and so that they're able to park in those spaces. We do also post on our website the RTS bus and a link to that, because there's the station right there across the street from Depot Park. So we're trying to encourage people to use that as well, to condense all of those parking pockets into one space. So that's where we need such a large amount of space for parking.
I remember. Thank you.
And I just want to clarify the shuttle that we use at for Depot Park. We actually bring in from Jacksonville. They're almost like golf cart shuttles. They're like little trains if you've seen them around. They cannot go on main city streets except for we get them permission for the city streets. They can't go on any highways or state FDOT roads. And they run by, correct me if I'm wrong, by tips. We pay a small fee, but they run off tips. So they're a great company. They also do, I think, St. Augustine Amphitheater. They do a couple of things around Jacksonville and St. Augustine. So.
Great. Thank you. Thank you all. Thank you, Mr. Mayor.
All right, thank you, Commissioner Wheeler. And I will say the last 2 years, both days, I parked parallel parked on Main Street between Depot and the roundabout. So, I mean, it was and then the smaller roundabout. So it's not 50,000 people all coming in at one point and staying and having to find places to park for 20,000 cars all at once. It's over the course of the time, and it's just not particularly intimidating once you just drive there and do it. So anyway, Commissioner Eastman.
Yeah, thank you, Mr. Mayor. I hear all the county commissioners on the fencing and trying to get that. I came here during the last discussion with that same topic of conversation, which is, as I saw from your 200 year, which was a great event in which it utilized that center road and then expanded out to Heartwood to the north. Man, that would be really cool to have over multiple weekends. You'd be able to expand the Hoggetowne Medieval Fair out. It would have that extra space that you were looking for. There's still the parking there. In fact, that could be even long-term sustainable for how the Medieval Fair could go forward. Like everything with these events, like the devil's always in the details. The devil's always in the details of all of this stuff. So one of the things that one, I think, as Roxy pointed out, is you cannot. You're asking first to start off, because we had a lot of folks that were on that medieval fair circuit that were here when we were having this conversation before. You're asking 150 to 160 people that own booths and 20 food vendors we have in our backup here that are coming in and they're setting up, and they care a lot about their stuff. They want that to be protected, want that to be safe. They cannot stake it into the ground. And so over the course of 2 weekends in an urban environment, you're asking people to get everything set up there, and then you have to have consistent security. You have to make sure that people can't get in there. You have to do that over the course of an entire week while you're only doing it for these 2 weekends. And the point of the 2 weekends, we also brought that up about 1 weekend versus 2 weekends. And it was actually some of the folks that were on that medieval fair kind of circuit, the folks who go and do only this, they say, if we're going to come all the way in and we're going to do all of this, having it, pay the amount of money that it costs to have it be paid for 1 weekend is rough, particularly because it could rain that whole weekend, right? The nice thing, most other medieval fairs that you see, there's 2 big ones that are around. They tend to be over the course of like 2 months or an entire month of medieval fairs where people can go. They can do that so that you just have less risk when you space it out over the course of a month. So all of that made it, I think it's more complicated than, though I personally think if there was some way to make it work, as you guys pointed out, copy what you guys did with the 200-year anniversary, have that be in Depot, expand it, have that be in downtown. You bring in economic growth into downtown. You have that go. You are able to have that extra space. I think that would be awesome. I don't know how it would work logistically with all of the rest of it that's going in there. And then on Newberry, could we, and having this outside the city, so philosophically, I'm fine with, I guess the point is, if the question is philosophically about gating off the park, I think people love the medieval fair, and that is fine. But I do think the hurdles are more as logistical as much as they are philosophical. But if the motion is just, I'm okay with telling my constituents that the medieval fair is important to have over 2 weekends, fence it off. I'm happy to make that motion. I don't think that's the main barrier here. The second point is that having it in Newberry, I'm not philosophically opposed to the idea of the city of Gainesville having something outside the city of Gainesville. But can we go forward 2 slides here? Oh, one more. So they pointed out that our staff has to drive all the way to wherever it is they are going, get that all set up. I know there's some staff members that have talked to me about, they are in specific divisions within there, and they spend the course of an entire month working on this. The longer you have them drive, the further it goes. And if you look at the expenses here, one thing that's not included in here is all of our staff time. There's the staff that's there, but not all of the individual folks, right? That doesn't include just our staff who are now allocating their hours away from all of this, right? Is that correct? So that's just that's taking staff outside of what they are doing day to day with Parks, Recreation, and Cultural Affairs and putting them into this. I think it's mostly just about, just driving all the way out to Newberry and back is the main logistical issue with having it out there. If it's closer, it's closer. If it's closer, you don't have that same sort of thing. And so to me, if the question is just philosophically, is the city commission comfortable with that? I personally am, but I do think that it's more complicated than all of that. But I came in with the same questions you guys did last time for both of those. And Roxy, do you want to add to that?
Mayor, Chair, Commissioners. So there's 34 park operations staff members that oversee 100 parks in the city. Having to transport these 34 out to Newberry for that whole month of setup, and probably even, it's about 2 months at that point, or a month and a half of setup, preparation to do all that at that distance. At that point, we're not maintaining our parks and our locations within the city, because I don't have the resources to be able to do both. So that is why we decided, okay, we're at a 4 mile, which is pushing it sometimes for us, because when we were out in Alachua over there at Archer, that was a challenge. It was a really big challenge. And so at that point, we realized we can't go beyond that limit, because then we can't continue maintaining our current parks within the city limits.
Yeah, perfect, Roxy. And so I guess just to that point, I did want to just get on the record. there's just huge economic development benefit for this for the entire county. I think Jessica sent this to me from Visit Gainesville. It brings that the medieval fair brings in $1.3 million in overall business sales. 662 jobs are supported. It has an ROI of 195%. That is all great, but we do. If the city of Gainesville is going to be taking its staff time and really having to decide how they're going to allocate that staff, we're happy to do that, but within the city of Gainesville, right? If that economic benefit's going to go to High Springs, going to go to Newberry, which is all fine and good, that is a lot of staff time for us to be allocating to all of that. But I do think that it's worth having this conversation, because the economic benefits of this are huge, and it's a real benefit to our community. That's why, Mr. Mayor. Thank you.
Joint county, city county,
right,
is what you're talking about, joint.
That's what, yeah.
Thank you, Commissioner Eastman. Commissioner Willits.
Sure. Thank you, Sonny. Thank you for talking a little bit about how the parking ended up kind of working, because the people who are very kind of used to that part of town, they all figured out their little corners where they thought, I know there's going to be parking here, freeing up some of the other places for out of town or folks coming from across the county. It ended up kind of working. I went both years, and it did. I think I parked parallel down Main Street, down by the Winn-Dixie. So as Commissioner Eastman said, philosophically, I'm fine with the idea that if we needed to use the fairgrounds, just because it's kind of the only thing, it would become more of a partnership with the county. But I hear that from our staff, city staff, that the distance just really becomes problematic when you have that many people taken out of circulation. Because it's not that we hire a bunch of temp staff who just, they can spend most of their time driving, and our normal staff is taking care of parks. Or if the fairgrounds was a 1 year, like if we had a permanent site picked out, but it wasn't ready this year, and we did a 1 year at the fairgrounds as a step towards that, it'd probably be practice towards our permanent site. I would be fine with that as well. I know that the 50,000 fairgoers looks impressive, but it really is because it's free. So I may have gone twice in one day as well, because it was free. For me, it was close in town. It was great. Like, I could catch it going one way and catch it going the other, right? So, for 10 as opposed to, I think traditionally tickets were 20, I think. So, cheaper, we could make the money, right? We could make some money and have some sitting. I don't doubt that. But the fencing off one of our jewel parks for that period of time worries me. Even when the big Tom Petty thing, there were a lot of pushback in the community because it felt like something we put all our money into was now a private park for even, I think it may have been a week that they had a week, 10 days maybe, however long. They had a period of time they had to, prepare. And there was a bit of a pushback, and I worry about that, I worry about that. But also, I also worry that some of these vendors, I think, are just sticking with us out of nostalgia. It is not the moneymaker it used to be for them, and that's why we need a different solution. Yes, there's a lot more people, but the kind of people who will go to a free event may also not be dropping, I don't know, $30 for a wand or whatever it is, or $100 for a sword, or those kind of things. I buy food and beer, so I don't know what everyone else buys when they're there. Yeah, turkey leg, whatnot. Turkey leg. But I also worry that we're going to drop out of the circuit, and then they won't be there when we eventually get a permanent site. And I'll just end with saying I really, really appreciate staff they've done all this work and presenting it to the county commission so they understand. We've been kicking this around and all these ideas, and the truth is we need land. We got close with the Birch property. It would have been not perfect, but I would have jumped on it and said, and that's why staff was going after it. We don't seem to have a very good solution besides this one year going forward. It's still a great event for both the city of Gainesville and for the county. Great event. It really, I think it worked enough in Depot that I'm glad that we were able to continue it going as opposed to not. But it can't be the permanent solution. I really do think we're going to lose our vendors eventually because it's not what they signed up for when they became, medieval fair folks. It's not their normal thing. So, but if there's opportunities for the city and the county to partner if there was something that we merely needed, I don't know, the county parking lot. If that's all we needed downtown, great, let's work it out. An eventual garage at the court services, great. But it sounds like that's not there's too many things keeping us. And I guess land, in the end, just we gotta find the right piece of land. So, I don't know. I don't have any solutions, but I would really want to appreciate staff, but also county commission for being willing to think about it. But we're still working out. Of course, Coppers is the end all be all. If the EPA moves, I think it'll be the perfect site that'll achieve a lot of what we want, and a site that some other people may be scared of using, but we can figure out how to use it for a short period of time every year for our fair and then other festivals. So, thank you, Sonny. Thank you, Mr. Mayor.
Thank you, Commissioner Willetts. Commissioner Cornell.
Okay, I guess we're on round two, right? Yeah, round two. So, first of all, thank you. What was the insurance for the raceway? Because the raceway seems like a good potential solution.
It we were thinking it would be fantastic. So our typical insurance, we get a $2 million policy. They wanted to increase it to a $4 million policy, which of course doubled the cost. We were able to manage that one. We have a lot of exemptions because there are so many different aspects of this fair. There's the jousters, there's the beer booths, there's camel rides.
No, but the reason that you said no was the insurance was too high. How much was the insurance?
It wasn't, well, by the time we said no, we had crested over $50,000 that we would be paying to purchase the 7-day event insurance.
So your budget went from 130 to 180.
Well, our budget for the 3-weekend event.
130,000 plus 50,000 is 180,000. You're shaking your head. It's not
I'm shaking no because 130,000 is what we spend for the 2-day at Depot Park. The 3-weekend event is 450,000.
What would it be for 2 weekends at the Gator Nationals with insurance?
So we never got to that point because the insurance company, when we told them we needed to add on all these extra additional riders for coverage, they said we can't give you a policy for that. So we never got to that final point and final cost.
So it wasn't as basic as double the cost. It was double the cost plus, oh my goodness, you got jousters. We can't insure jousters and
yeah, they do this everywhere around the country. Like, clearly there has to be an insurance solution to this. Like, they literally travel around the country doing these.
Well, I don't want to lose my life.
Okay.
So hold on. So
Let me
Yeah.
clarify a little bit with the insurance.
Okay.
Typically, what we do is we pay for our $1 million insurance, and then all of our vendors pay for their insurance.
Okay.
The Raceway wouldn't allow that.
Okay.
They were asking the city to take on all of the other liability, and then our insurance provider said, no,
Not gonna do it, got it, okay.
not gonna do it. So that was that last, we were getting there, we were gonna say, okay, we're gonna bite that off with $50,000, all right, and then that last little bit of us taking on that insurance for all of our vendors, that's when they said
Yeah,
no.
so we're self-insured, maybe you can call the county for that one, I don't know. I mean, the way I look at it is, it seems like a really good, maybe temporary solution until we wait out Cabot Coppers. You know, Commissioner Alfred had to leave for doctors, and Chair Chestnut is caught up at the doctor, so I apologize that we only have 3 of us here, so I won't make a motion, but what I would support to my colleagues is move that we refer to staff to consider a jointly sponsored city and county partnership for a ticketed event in fiscal year 26. I mean, I gotta believe that if we came together, both our staffs, and we couldn't find another site, so we did the fest solution, and we ticketed it, and it was $10 or $15, then to Commissioner Willis's point, we're gonna find out of the 50,000 people that came last year, 13,000 will pay, or 15,000 will pay. We tell the vendors we're looking for a long-term permanent solution, and we don't lose any money, and I think we now know a lot more because it's not a free event. And I would ask our staff though, I mean, I don't like figuring stuff out up here. I like sending it back to our staff, and if you all support that kind of a motion, then we can have our staff work with their staff and try to come up with a ticketed event that is revenue neutral, or at least maybe even make some money that we can put in a pot for y'all for the next year long term. I mean, I'm not interested in the county making money. I'm interested in helping the city find a solution to an amazing countywide event that I love going to. I haven't been going for 30 years, but I carried that turkey thing around with Connor. He's 32 now. I think he was 18. So I've been going for a bit. Yeah, it was fun, and it's great, and I love it. So that's my suggestion to my 2 colleagues that are left here. I conclude, Mr. Mayor.
Great, we got, thank you, Commissioner Cornell. So I've got, I think probably Commissioner Book, and then Commissioner Chestnut, and then Commissioner Eagles, whose light doesn't work still. All right, Commissioner Book.
All right, thank you, Mr. Mayor. I hope that the audio is okay.
You're good, yes, sir.
Excellent, excellent. I'm in South Florida at a conference, or I would be with you in person. I would say that the 3-weekend length is very, very difficult to overcome. So that means, as some have alluded to, we do need to reimagine the manner in which we hold this event. We had spoken as a city commission with our staff about something that Commissioner Cornell alluded to, which is how do you fence it? And we talked about some potential road closures at that time. Perhaps a very small piece of South Main, perhaps a piece of Southeast Depot Avenue, or south where we have some RTS property. Where were we at as far as that research? Because that would give us additional space. I realize it's additional logistics, so that's probably a question for staff.
All right, Ms. Gonzalez.
Mayor, Chair, Commissioners, to answer that question is we have, we're still in process of doing more research as to what that's going to look fiscally. So in reality, that's going to be an increase in cost from the 130 that we anticipated and what we needed budgeted. And in regards to fiscal year 26, I would like to state that if we can look at this for fiscal year 27, would be a lot more beneficial. This event starts in January, so the planning process is already in play for this event, one. And then the other challenge with that also is in closing off this fiscal year 26, closing off the park for that, we also have to, we would like to come back to the commission with what that cost would look like so that we can evaluate that accurately, because it is going to be an increase in cost towards our expenditures. The $130,000 that we are utilizing for fiscal year 26 is to do the same event we did last fiscal year. So in closing off, that's going to be added cost in fencing, and that's going to be added cost in security, and all the other details, the logistics that come to play with that.
Yeah, we knew that. That's why we kind of were discussing that, just several weeks ago. But the opportunity to reimagine potentially, like Commissioner Eastman referenced, downtown venue we talked about before. We recognize that some of the things, if we're not going to ticket, it's going to be increased cost. I do think we should see if it's potential to ticket. And if the county were able to provide some funding that might help us mitigate that, then anything they provide, if we ended up with, let's say, revenue beyond expenses, that's probably very unlikely, but if we did, we cost share the revenue above the expenses. Otherwise, it's really just the county helping the city with a huge economic development event that benefits, as Commissioner Eastman said, a lot larger than just the city. I think from a practical and logical perspective, we would not spend to put the event in another municipality, just as they probably wouldn't spend to put an event in the city of Gainesville. But I do think we need to be thinking about enlarging the existing space and using what we have right around us and using downtown, and then see if there's a price point for ticketing that might get as many people in there as possible. Thank you, Mr. Mayor.
Thank you, Commissioner Book. And let me just interject here before we go too far afield with this, because we're going to talk about this all day, I'll promise you. We may as well go ahead and order dinner on this issue. What I think what we're really looking for, we know how to do a ticketed event. We've done ticketed events downtown before for the city of Gainesville. Fest is one that we do every year. So we have a facility for that. I think what we're interested in is finding out if there's any temperature from the county commission to help fund what is likely to be an open event this year. And if not, that's okay, but I think that's really the question on the table. So, yeah. Commissioner Chestnut.
Thank you, Mr. Mayor. I was going to say, I think what we're asking for today is one, a jointly sponsored event. Two, looking towards the future for a festival in Arts Park that would be jointly run by the city and county. If I had my druthers, of course, everyone knows I would like for this to be at the Gainesville Raceway. And I think the people who need to be at the table talking to the Gainesville Raceway are the policymakers. And even beyond today, I think it's really worthwhile for the policymakers to go out, sit down, and approach the Gainesville Raceway in terms of looking at the insurance and in terms of looking at this as a city-county joint event. That's one. This time, we're asking you, the county, to help us in a jointly sponsored event. Now, we just have a problem with Depot. You can't put stakes in the ground. Would that not cause contamination? That is the problem. So putting stakes in the ground is a real problem, which then leads us back to how do we get to having a place to go, and working with the city and the county, blocking off the streets may work. But today, I think Commissioner Carnell's motion for the county for a jointly funded event, and the city to look at a jointly funded with the county. And I would make a motion for the city to look at a jointly funded with the county. And secondly, for the policymakers to sit down with the Gainesville Raceway to talk to them.
So is that a second? Is there a second for that?
Second.
All right, we have a motion and a second. Commissioner Engel. Thank you, Commissioner Chestnut. Or did you have, you good? Okay, all right. Okay. Commissioner Engel. No.
So then, where we are, we have a motion on the floor for a jointly funded ticketed event. Is that correct? Oh,
that is correct.
That's not, never mind. I pull it back.
So I had a few things to say about kind of the situation in total. One, I think we are kind of a crossroads of what the medieval fair is going to be. The medieval fair was out at the Alachua County Fairgrounds, and it started. Let me say, I've been going to this event since it was at the Thomas Center. I was a little kid. I couldn't have told you what year it was, but if your slides are correct, I was somewhere between 9 and 12 years old. So it's one of my earliest memories, like coming down to visit family and stuff in Gainesville. Was this cool medieval fair thing, because we didn't have anything like that back home. When it moved out of the fairgrounds, it kind of grew into that space. And like the reason it became such an amazing event was because it had the opportunity to like organically fill that space, and we were able to bring in jousters, and we were able to bring in the living chessboard and falconeers, and like acts from all over the state and the country came to Gainesville to put on there. That's not going to happen in Depot, just not. Like, the Depot is not able to support that. I think it could be a similar program to Fest, where instead of driving around downtown Gainesville and seeing a whole bunch of people in black t-shirts with spiky hair and chain collars, it could be driving around downtown Gainesville and seeing a whole bunch of people in robes and crowns and tabards and hanging out and bidding music. That could be super cool. It would be, in my opinion, like really good for the city of Gainesville, but it would also be really bad for the fair. Like, it is going to be a diminished event if that's what we do with it. Like, it's not going to attract the same people, because you're not going to get people coming down for 3 weeks to set up. You're not going to have the same type of just event that you had at Depot, or sorry, at the fairgrounds. So looking around for places that we can use that fit those criteria, we couldn't find any. And we're not suddenly going to find some. Right? They don't exist. They're not going to exist shortly. So I think we need to make the decision, is it something we want to try and keep to those criteria? Or are we willing to look at something outside and look at more of a joint city-county event than just a City of Gainesville thing? And the truth is, it may have grown to the point where we don't have an appropriate place to put it in the City of Gainesville. Maybe that's Newberry. I'm a little concerned about the western side of the county, just that a lot of my friends are participants and vendors and those things in this, and a lot of the people that come in from out of town come from Jacksonville and those areas where they're driving down to it, and putting them on the west side of the county may make it a little bit harder to attract some of those, but I don't know. But there's a possibility with like Walnut Motorsports or some of those places. So I think if the county is willing to look at it, we should really look at, probably not this upcoming year because the plans are already in place, we're already going forward, but the year after that, I think it'd be very hard for 6 months from now to radically change what we're going to do in Depot. But the next fiscal year, see if there's not some place we can collaboratively work on putting that's a little bit further outside of the city. I think there is some real benefits to doing that. One, I just think like collaboration between the city and the county is always an awesome thing, and I'd really like to see some event like that we could pull off. I think realistically, if we're going to have the same level of event before that pulls the same regional and national kind of performers and vendors and those type of things, it's going to have to be something bigger than the city of Gainesville has to offer. One of the things that I don't really think we've taken into consideration is the awesome soundtrack of this meeting.
I feel like we could do better.
That's our cue. She's like,
Wrap it up, Commissioner.
We needed that.
And it works even better with this point. One of the things that I think we really haven't taken into consideration with this is a possibility if we worked jointly on this to where it was a joint Alachua and Gainesville event. There's a real possibility of a medieval version of the Alachua County Fair song. That could happen. So I just think there's a lot of opportunities there. If we want to turn it into a real event, we really have to start looking outside the city of Gainesville. I think 6 months from now is way too short a time frame to realistically do that, but I would like to see something from the county being interested in looking at fiscal year, I guess that would be fiscal year 27, at finding some place that works outside the city and how it is we could jointly use staff, so we're not putting Gainesville staff traveling 45 minutes away. But I think there's some real opportunities there, and I think we're probably stronger together than we are individually. That's what I
All right. Thank you, Commissioner Engel. Commissioner Eastman.
All right, Commissioner Engel said everything I was going to say, except probably better than I would have said it. Congrats. I will say, though, to jump off of Commissioner Willis's point, that, well, to start off, I think everybody wants to have a ticketed event. I think, and Commissioner Willis pointed out that there were folks that were concerned about the sustainability of the medieval fair. I mean, as I mentioned, we have 150 to 160 people coming in with booths. They have all stated that they are doing that because, you know, they've been doing the medieval fair for many, many years, but doing all of this setup, coming into Gainesville, doing all the setup, only to break it down after 2 days is the kind of thing that wears on you and gets frustrating when they can go down to Deerfield Beach, they can go down to some of the bigger medieval fairs and set things up for a whole month, have their business grow within that section and do all of that. And so I think I agree with Commissioner Engel. We need to find a way to make this sustainable, make it larger, somehow find a way to get it probably not within the 3 mile radius that we have, unless Cabot Coppers picks back up, which, as I think someone alluded to, the EPA, a very small staffed EPA, is going to have to push forward on. We're going to have to figure out some kind of a solution here that keeps this self-sustaining. And just to also kind of point out the obvious, like the revenue is self-sustaining when it's ticketed. And the city of Gainesville has all the staff that's been doing it for 30 some odd years. What the ask here is as we are moving into that, is the county interested in helping with the open event just for fiscal year 26 and then working with us in fiscal year 27? And as I think as the mayor pointed out, that's not something the county's interested in. That's perfectly fine, but I think it's worth having that conversation because this is an economic driver for the entire area. That's all I have. Thank you, Mr. Mayor.
Thank you, Mr. Eastman. Commissioner Prizia.
Okay, I want, I guess, to Ken, you know, I want to clarify my money conversation. I was kind of joking about splitting the revenue. What I meant was just that if we have revenue, like, let's put it towards a long-term solution to this problem, right? Like, let's not just have it get tucked into whatever budget. I guess it goes into Parks and Rec broadly speaking, but like, if we're going to try to work towards a long-term like land solution, like, let's put it there or something. I am in favor of a ticketed event. I think it makes the most sense. I can't get off of the fairgrounds. I'm sorry. I hear you all, but like, you want to be a joint city county. That's our fairgrounds. That's our facility. It's set up for this. It's set up for animals. It's set up for a 2,000 person arena. We have staff that run that space. We have a concessionaire that runs that space that would be helping set it up. If you want it to be a joint city county event, we would be contributing staff time, people that would help set up. Like, we have Parks and Rec staff that help with that space. Our tourism people do marketing and communications in that space and help sell tickets. Like, that is the space to have a joint event. And it's already, we can fence it off easily. We have entrances and exits. It literally checks every box. And I don't know how the analysis was done, but it's a 30-acre property, and extension adds another 35, I think. And extension adds another 5. So we're looking at 30 to 40 acres, you know? And there's multiple fields that I'm sure we could get for parking. Yes, we'd have to figure out how to smooth them out so they're not so bumpy or whatever. But like, again, we get people to the moon, we can figure out parking. I just feel like it makes sense for a joint partnership location temporarily, and then we figure out long term. I think the raceway is figure outable because we give them $50,000 in tourism bed tax every year. Like, we're giving them money to market and promote their events. They can be an equal partner in collaborating with us on this insurance thing. And we, to your point, are self-insured. So if it's a joint city-county event, then, you know, maybe we help with the conversation around the insurance thing.
Can we refer to our
That's what I'm
staff?
saying, policymakers, sit down with them.
Yeah.
So, can I speak to my commissioner?
Yeah, we can refer to staff to
Yes.
figure out, but what I don't want is that, this is the thing, I feel like right now what's happening, and I'm not trying to be confrontational, but I feel like when we're talking about the event at Depot, it's open and it's 11 acres and it's small and it's one weekend and it's free. And then when we start talking about a joint event, it's 2 weekends and it's fenced off and it's, you know, I'm like, what are you, I want to be very clear about what it is that we're partnering on and what we're getting ourselves into in terms of cost, because we already put $10,000 a year into this event. Like bed tax, we give you all $10,000 in bed tax for this event, and the generates about generates about half that. So half of it is money that we're giving to the event. The other half is money that really we're technically just giving back to you for the money that you generate in bed tax. But that's already happening. So I just want to make sure, like, they're talking about $130,000. That means $50,000, $60,000, $65,000 or $70,000 they're asking us for.
So what if we asked, just referred to our, Mr. Well, I'm the chair, wait. What if we asked to refer to our staff to come back with some potential short-term solutions in 26? I think the raceway with a call from county staff is a different conversation because it's a county And so I think our staff can handle that. They can very quickly put together the Newberry option, and the Fairgrounds option, which I hear you, but I'm more in favor of the Raceway. And they can also talk to the city about, I know you don't want to fence it, but for 1 year, how about we try it? But why don't we refer that back to our staff to come up with 2 or 3 options, and then the city can say, no thanks, we'll do it on our own, or thank you for presenting those options. I mean, and I think also that will give our staff an opportunity to work with their staff about long-term, this could be a great partnership. I'm not so sure that we couldn't pull this off at West End. We just did the World Masters at West End. It's not quite as far. It maybe doesn't have as much parking, and Michelle's shaking no, don't you say that. So, but again, this is what I don't want to do up here. I want to let them work with.
No, I'm fine with that. I just don't hear that. I don't hear that there is, like, right now, I don't hear that the city and the county are saying the same kinds of things right now. I mean, I started to hear it with you saying long-term, different locations, but like, I just want to make sure we refer it, and then it just becomes this like behind the scenes.
No, the city could say to the vendors, 1 more year at Depot Park, it's ticketed, and I know it's not perfect. We're coming up with a long-term solution.
Yeah.
We now have a county partner.
And
Fine,
that's
motion
basically
to
what
refer.
we've already done, is saying that this coming January, it's gonna be a Depot Park. I mean, that's what we're doing.
And it's
for
not
this
going to be
council.
ticketed.
It's probably not ticketed, unless somebody come up with a real simple plan real fast, but yeah.
Okay. Well, I'll leave it to Anna. Do you want to do a motion, or do you want to let staff heard our discussion and Mark's wanting a motion? Michelle wants a motion.
Yeah, but we can move and ask staff to come up with potential partnership opportunities for a ticketed event in 2026 and to explore longer term solutions around the Raceway and other options in 2027.
Okay, motion and second. Any further discussion from my board? Anyone from the city wants to weigh in on this motion? I hear you saying that it's not ticketed, and we're saying we want it ticketed, but maybe our staff can sort something out.
So I got another light down here, okay, Commissioner Willets, and then we need to go to the public. too.
Right, thank you, Mr. Mayor. So, just the county's motion is currently about 26, we were already planning Depot Park unticketed. It's our 2-day, hopefully 50,000 people, show up. I don't want to put on our staff trying to come up with ticketed this late. When we were talking about it 3 months ago, we kind of on the city side said, all right, we're not going to force you to do the hard, perhaps impossible thing. But Commissioner Prizzi, I hear you that facility it checks a lot of the boxes. And so I would be willing that if it's that in 27, that is a step towards something else, then to me it makes a lot of sense. We may discover our clientele don't want to drive that far, right? But if it was a step towards perhaps the Raceway is ready in 28 and we kind of have a longer term plan for the Raceway, yeah, Coppers is our top pick. I think it's everybody's top pick. Outside of that, the Raceway seems to make a lot of sense. And then outside of that, we don't know I don't think we've heard consensus, partially because we don't have a site. Depot is, too small, it's problematic. We make it work out of, pure love for Gainesville and love for the Faire. I personally am willing that if it was just 1 year as a transition to use the fairground, because like you said, it's got a lot of what we need. It would hurt a little bit to not be, real close to Gainesville or in Gainesville, but as a transition, I would be fine with that. But we don't have that permanency down yet. So,
Commissioner, do you support the motion of putting the county staff to work to help?
well, I don't get a vote on your motion.
Well, no, this is discussion on our motion, because your motion's not on the floor.
Telling the city staff right now to go figure out a plan to fence it, from what I've already been hearing, no, I think we need to go another year with the free unfenced.
You want partnership. What I'm saying is if you want partnership, move it to the fairgrounds. We will partner with you. Our staff will put time into it. Our people will put time into it. We'll help with marketing. We already give you 10,000 in bed time.
I'm the only one up here who has suggested yes. So
I'm just saying,
treat me like an ally. Come on. I'm a lot closer to saying try it. My only fear is that because we don't have a more permanent plan, that would become like the default and the normal, and it would be 26 and 27. And I'm willing that to if we're getting a lot of help from the county staff and whatnot, that we go take that opportunity. but I would have to find some consensus against my colleagues.
But I'm all for trying to go for the raceway, because I agree with Commissioner Chestnut. I think that's the best location. It's close to town. It makes sense. It's the right size. It's the right scale. Like, I don't think the fairgrounds is the right place long term. I'm just saying, if you're asking for partnership, we don't have a lot of extra cash to throw around either right now. What we do have to offer is a location and staff time that's already taking care of that location to be an event space. You know, that's kind of what I'm saying.
So we'll roll back around to everybody, don't worry. But let me just say, the issue with the raceway is a financial risk management issue. Is that accurate to say? I don't know where. Okay. It's a financial risk management issue. It's not a logistics issue at all. The fairgrounds, I just Googled it up, is 18 miles from where our staff works. That's an issue. And also, downtown, at Depot Park, there is a benefit to downtown Gainesville, to having it in downtown Gainesville. We lose that entirely by moving it to Newberry. And let's call it that, because it's not just the fairgrounds, it's Newberry. So that's a thing that I can't support certainly right now. We know we're moving already, the momentum exists, we know how to set it up for 6 months from now, a few blocks from here, and that is what is most likely to happen this year without turning the whole thing upside down. But in January 27, that's what we're looking at, and if right, and if we can get help on the financial risk management issues with the raceway, then that works all of a sudden. You know, that's a thing that works. So all that said, Commissioner Chestnut.
Thank you, Mr. Mayor. And what I am driving to is to have the commissioners to sit down with the raceway. I think, yeah, I think that you may get a different answer, but to fully explore that. So I give up on trying to get a ticketed event. So we're not going to have a ticketed event for 26. But I am very concerned that we work towards a joint event at the raceway for 2027. Now, if the policymakers sit down with the raceway and they don't move on that, we will fully have fleshed that out. I don't believe we have fully fleshed out this question yet. So my motion for the city is to refer to staff to work with county staff to jointly develop a plan to look at alternative sites, including the Gainesville Raceway for the Hoggetowne Medieval Fair in 27.
Okay, we have a motion and a second. All right, Commissioner Duncan Walker, it's up to you.
Thank you.
Thank you, Mr. Mayor. I did just want to say that I can support the idea of the raceway. I know that this commission, when we've been having conversations about other events, whether they were ours or others that other individuals wanted us to support, had oftentimes referred to the raceway, but there were a lot of things that were kind of prohibiting that. So I'm happy to have that conversation for that purpose. But also, I heard a colleague mention the integrity of the event, or maybe it was staff. You know, the integrity of that event, I think, is very, very important when you start talking about its sustainability. I don't know a whole lot about the medieval fair circuit, but apparently that's a thing. And it's a thing. And that's important. I think if we're going to talk about planning this out years down the line, we must consider that. So the integrity of this event, making sure that it is placed properly, is crucial so that we can attract the vendors, we can keep the audience. All of those things are really, really critical. I wanted to kind of shift us, though, a little bit. I do support that raceway idea. I want to shift us, though, because there's another part of this recommendation that I don't think we've touched. We've been having a lot of conversation about the immediate thing. I'm looking at the permanent festival and arts park. And that's a much broader conversation. We haven't really touched that. I'm curious to hear from my colleagues about their sentiments on that, and maybe even staff would have to come up and at least touch that a little bit more. I do have this question. Obviously, the medieval fair would be one of the events, but if you could come, someone could come and tell us some of the other events that would happen here. We're asking for a permanent festival and arts park, and I think that my colleagues and certainly the public would want to learn more about why we think it's important to have one.
Mayor, Commissioners, one of the things that we had looked at in finding our own site was what kind of benefit, and do we want to put in all this information or all this money from, say, Wild Spaces, Public Places, which we do have an allotment of money for this particular project. Would we want to put all of that into something just for the Hoggetowne Medieval Fair? And we said, no, that wouldn't be fiscally responsible. So one of the things that we had worked on, and we came up with a plan for a festival and arts park, and that it would be a place for people with big events like the Hoggetowne Medieval Fair, with camping on site, parking on site, water, infrastructure, fencing, ticketing booths, of a vast size that would be able to handle things like drive-through Christmas lights, or I think, gosh, there's so many different events, but any kinds of fairs, big, and I'm talking about the big traveling kind that we could bring in from out of town. We could bring back the Indigenous Peoples Day event that was really big, that came in from a local group that was handling that one. So there's these very large events that we could bring in to the site. We would rent it out, so it would have a revenue generation side to it that in hopes would pay for the staffing and the maintenance and everything for that site. So that's what we were looking at, and it would be specifically for festival and arts. So we're not looking for boat expos, we're not looking for anything like that. We would really be looking for how could we build the cultural sector of Gainesville and make it a tourist destination in that way. And so that's where that festival and arts park came to fruition.
Mm-hmm. And you're looking, it seems here, Ms. Ladendorf, you're looking for a partnership with the county on that as well. Mm-hmm.
Yeah.
Mm-hmm. So are you able
discussion.
to, are you able to give a little more in depth, and probably not because I don't think I saw it in the presentation, but at some point, kind of flesh out the ideas that you've talked about here? Because
Yes.
I'm sure they'll want to hear some numbers.
Yeah, we'd have to update them. It's been a while, but yeah, we did have some numbers. In the Birch property that we looked at, that you saw that we had wanted to purchase, where there was 3 parcels, Waldo Road, that was our original goal, was to purchase that land so we could do the fair and the festival and arts park all in that space.
Mm-hmm. Okay. All right. Thank you for that. I just wanted to kind of flesh that out because I knew it was a part of the recommendation that we had not touched yet. We've had a long, long conversation about the other pieces, but that here is clearly part of the ask. So I want to hear a little bit more from my colleagues, and then we'll figure out how this gets wrapped in, or maybe if this becomes a part of a separate conversation at a different time. Thank you very much.
Thank you, Commissioner Duncan Walker. Commissioner Eastman.
Yeah, well, reiterating what the mayor said, this is the kind of thing that we could talk about all day. I think the last time we brought this up on the commission, it was just twice as long as this. The one thing I do think that may help jostle this, I mean, we've all talked about the Gainesville Raceway, and all we're trying to do is sort of jostle the thing, maybe unstick it a little bit. I do think that potentially sending a joint letter from the city and county commissions to the Gainesville Raceway, encouraging them to work with the elected officials and the staff to continue the event there, might just get them to open their eyes a little bit more and say, oh, okay, well, maybe we should take a second look at some of the insurance issues that are in there. And so I would like to make a motion that the city and county send a joint letter to the Gainesville Raceway.
Hold on, she already did, there's a motion on the table.
Wait, you put a letter there as well. You said to look at other, could you include that in your motion?
I can include that, but yes,
Okay.
I got a motion on the floor.
Okay.
So I'll be happy to include that.
Okay, that's fine.
Good. Commissioner Duncan Walker, you good with that?
I'll be happy to.
Great.
Yeah.
Okay. All right, so you good?
I'm great. Thanks.
All right. Commissioner Brizia, and then we're going to the public.
Just quickly on the music, or the arts and festival permanent park. I mean, honestly, like, we have a parks master plan. We have a process for the way that we're investing our parks money and our wild spaces, public places money. I don't know where we would find other money. There also is a private sector entity. It's a nonprofit organization that currently has a proposal out for a music and festival park in the Melrose area in eastern Alachua County, that I think is gonna, if it's successful, is gonna be a really amazing potential opportunity, and it will bring economic development to Gainesville, because this is where all the hotels are, this is where all the restaurants are, this is where people will stay, and other than the ones that maybe camp for like one festival, but for all the other things that rent and use that space. So I would also just encourage the city colleagues, if they're not familiar with the Wildflowers Music Park proposal and what's out there about that, to get familiar with it. I'm happy to share what they've given me so far in terms of their proposals. And you can always talk to the people who are behind it, because they're mostly locals. But that may be a potential location. Again, it's not within 4 miles, but it's closer than Newberry maybe to downtown Gainesville. And it could be a permanent location home. I mean, there's tons of land out there for the medieval fair as well as for other festivals and music parks. And that would give some private sector partnership in there and bring some private sector dollars to the table for us too. So, and that was the other thing I was going to mention is just sponsorships for this medieval fair. Y'all did an amazing job of getting sponsorships for your Christmas parade. I wonder if there's more opportunity to do stuff like that for us to collaborate on getting sponsorships for the medieval fair. So neither of us is having to foot the bill, and instead, the local businesses that are benefiting from this, from the economic development, be the ones that help foot the bill to make this thing possible. So, thanks.
Thank you, Commissioner Prizzi. Thank you for mentioning wildflowers. I'd been waiting for that to come up. It's a great idea, and I'm a huge supporter of the idea of the Wildflowers Musical Park out in Melrose. If you haven't been out there and looked at it, I think it's a great potential partner in all this. And it's a whole lot easier for me to feel good about sending the medieval fair to eastern Alachua County than to far western Alachua County. That's a much easier sell for this vote. But anyway,
Mr. Mayor.
That's a great opportunity, and I'm looking forward to it. Commissioner Engel. Then I swear to the people.
Sure. Just a technical question. Like this, it's my first joint meeting, so it seems like we've got multiple motions.
You got to have one of each. Yeah.
2 different motions.
Okay, and so how does that usually work with motions in the public?
So we're having 2 meetings at the same time.
Gotcha.
Is the way that works. So it's got to be a county motion and a city motion, or not. I mean, like.
Direct your staff, we direct our staff. There's a little bit different, but in this, if I may, in this case, if we direct our staff, even though we may want something ticketed in 26, that's not going to happen from the city, but it actually gets our staff working on a long-term solution. Whereas your motion asks your staff to deal with the raceway, which is obviously a potential solution in our motion, so it gets them working on that. That's how I interpreted Commissioners.
Sure, thanks. That's how I just wasn't sure how the meeting functioned technically. Thank you.
As opposed to MTPO, which is same people but working a little differently procedurally. So, yeah. Okay. All right. Do we have public comment? I assume we do.
Yes, Mr. Mayor. We have His Royal Highness Michael Huey.
Welcome.
Good afternoon. I'm Michael Huey. I live in Jonesville. I am a retired associate professor of family medicine at UF and at Emory University, and actually for 3 years I was the lead faculty physician at the Eastside Clinic. But more germane to our discussion today, for the past 28 years, my wife Fontaine and I have had the privilege to serve as King William and Queen Caroline of Hoggetowne. If I had to sum up the Hoggetowne Medieval Fair in a single word, that word would be family. Our job as the royal couple is to engage fairgoers in conversation, pose for photos on the throne, knight children and adults, and lead the royal procession. The word family comes up all day long, every day of the fair. We see a young married couple who want us to knight their newborn child, and the proud grandparents step tearfully forward and they show us a photograph of their daughter sitting with us on the throne 25 years ago as a baby. So a third generation of their family joins the royal house of Hoggetowne. We see a teenager wearing 17 royal medallions like a medieval Michael Phelps. And we ask, because we always do, how many years have you been coming to the fair? And he proudly answers 18. He's 17 years old. He takes out a photo of his very pregnant mother sitting on the throne with us, and he smiles. His entire life, he's been part of the Hoggetowne family. And we always ask children and adults, where is your castle located? And yes, frequently they say Gainesville, but they also say Jacksonville and Tampa. And sometimes those are the most common answers, not Gainesville. And they come from other states, and they come from other countries, and they come to Hoggetowne. Fair vendors and performers invariably tell us that Hoggetowne is their favorite fair. And they go to many. So why is that? Because it's so charming and it's so family focused. So why did 50,000 people come to a 2-day Hoggetowne Medieval Fair at Depot Park in 2025? It's difficult to think of an Alachua County event other than a Gator football game or Gator Nationals that would bring together 50,000 people in one weekend. So what's that about? And while it's appropriate for us to say, yes, the fair was free, I think we all believe that it's more. That it's more than that. So people will gladly pay to come to the fair when we can get to that point again, because it's their fair. And it's an essential part of their year. They dress up in medieval garb and they go back in time, and then they feature the fair with photos on their holiday cards and on their Facebook accounts and on their refrigerator doors, because Hoggetowne is family. Thank you.
Very good. Thank you.
Thank you, Mr. Mayor. I'm guessing we might have one more speaker. No, not to this one. Okay, that was our final speaker.
Okay, very good. So back to the commission. I see no further lights. So of course we do. Commissioner Eastman.
Sorry, I just wanted to say that my motion called for a joint city-county letter to be sent. If we wanted that, then the county.
You don't have a motion.
The motion that I tried to bring forward that Cynthia Chestnut put into her motion, which would mean that if the county wanted to join in a joint letter, they would have to put that into their motion.
Yes.
All right, that's it. Thank you, Mr. Mayor.
Thank you, Commissioner Eastman. Commissioner Wheeler.
Just, Michael, thank you for the memory. My husband and I got our wedding rings at the Medieval Fair in 1989. It was just a little Celtic knot, and I thank you so much for that memory. Thank you, Mr. Mayor.
Commissioner Wheeler. Let's see, Commissioner Chestnut.
Thank you, Mr. Mayor. I can read it.
Please do, yes, thank you.
A motion. Thank you. One is to refer to staff to work with county staff to jointly develop a plan to look at alternative sites, including the raceway for the Hoggetowne Medieval Fair in 2027. Secondly, the chair of the county commission and mayor send a joint letter to the Gainesville Raceway to consider insurance issues surrounding rental of the facility.
And Commissioner Duckworth,
Yes.
you're good, okay. All right, all in favor on city, say aye, please.
Aye.
Any opposed? All right, that passes unanimously. Mr.
Look
Chair.
at all the fun issues over here at the city. Don't have highnesses and queens coming to our meetings. Anna, do you want to repeat your motion? Or, I think our.
It's a mirror motion.
It's similar, yeah.
Yeah, it's a mirror motion to Commissioner Chestnut.
Okay, all in favor, say aye.
Aye.
Any opposed? That motion's unanimous. Thank you, Mr. Mayor.
All right, I was going to say, let's take 10, but let's plow on through, and if anybody needs to get up and walk around and stretch your legs, then go ahead and do that. But
I have an event at 6, so we're going to lose.
let's keep right on going.
5 till,
Yep.
so.
Madam Clerk.
Mr. Mayor, we are on to 2025-481 Regional Transit System Weekend Service on Route 26 with the recommendation the Joint City-County Commission agreed to add weekend service to Route 26, authorize the city and county managers or designees to execute related documents memorializing the commissioner's decision, subject to approval as to form and legality by the city and county attorneys.
Welcome, Mr. Persons.
We're on a roll. All right. Andrew Persons, Chief Operating Officer, City. This was an item I believe that the county put on for discussion. This is, as the commission's aware, the city terminated the Route 25 with the spring term. This was a route that was 100% funded by UF. And the discussion has been the weekend service on the 26th. If I can get the overhead real quick, I can show the routes. There we go. Route 25, which was the one that was ended, is outlined here in green. As you can see, it comes up to the airport here. Route 26, which currently runs through the week but does not have weekend services, in red. In order to add weekend service to the 26, it would be roughly about $100,000. And that is what we have for you. We can answer any questions you may have.
Any lights? Anybody have anything to add to that? I think Commissioner Prizia probably wanted to add something to that. So do we have any public comment waiting on this?
We do not.
Okay, let me ask also, Mr. Persons, when we say $100,000, that's an annual cost, or is that?
Correct. Yeah, annually.
Okay, very good. Commissioner Willits.
Thank you, Mr. Mayor. And so, Mr. Persons, this is, just so that we all remember, we've been doing extensive work with UF, RTS,
yes,
and city staff over the course of now, let's call it 18 months or so, of really trying to figure out how to have a mutual beneficial, plan for how to provide transportation, with the university wanting to change some of what they do and saying that they would like to have fewer hours of service. And that's where part of this comes in, that we don't really have the wiggle money within RTS.
Correct.
To just say, hey, no, let's recommit to this. But there's a big interest of people being able to get out. I just want to make sure we're honest about it, that largely serving grace on the weekend is very important for people who still need to get to their job, who still might need to get to different forms of medical care on the weekends. They're pretty well served decently enough during the week, but it's really just the weekend. So I just want to make sure, say that out there, that this is not just because we need to get people to the airport necessarily on the weekend, which is still great if you want to take the bus instead of Ubering out there or paying to park in the very nice new garage. So that's one of the big issues. So I just wanted to make sure to say that. And I would love for the county to help us out with, this is one where we just, in our budget, definitely in RTS, and then outside of RTS, there's just not an available pool because we're just so unsure about funding. Otherwise, in my mind, this is the first thing we would have added back. If there was any wiggle room at the end of the year or going into, this would be, in essence, kind of the top priority, at least in my mind. So if the county would like to go forward with this, I have nothing but appreciation for helping out a community that just needs to get back and forth. So I would love it. So, and will Commissioner Prizia be returning? Okay, perfect. Thanks.
All right, thank you, Commissioner Willits. Commissioner Eastman.
Yeah, so this was part of the discussions that we've been having. How did this get on this joint meeting, and what have the discussions been back with as it relates to the conversation between UF, the city, and the county about this route going up to the airport?
Mr. Mayor, this and Chair, this specifically came up when there was a recent discussion at the county commission about the contract with the county for RTS, and then there was a discussion that I think germinated, and just there was a referral to this joint meeting to talk specifically about the 26th having weekend service. And again, Mr. Mayor, I'm happy to talk about the 18 months of discussion with UF. Ultimately, the 25 was 100% funded by UF, and as Commissioner Willits indicated, UF is changing both their routes as well as the service frequency based on ongoing discussions, and this was one of the routes. The 25 was identified as one of the routes that they felt like was no longer needed for their service. And specifically, we have seen an uptick in ridership on the 26 since the 25 was ended. Largely, that uptick that we're seeing is between UF and downtown, less so from downtown to the airport.
All right, good. Perfect. Thank you, Mr. President.
All right, Commissioner Duncan Walker.
Thank you.
Thanks, Mr. Mayor, and thank you, Andrew, for that information. I had the opportunity to go out to Grace Marketplace about a couple of weeks ago, and I was reminded about just how critical the needs are out there. I mean, for some very obvious reasons. But when I had the chance to go out a couple of weeks ago, I actually had the chance to hear about the impacts of losing this route. One of the saddest things for me to see, and I actually saw it on that day, were some people, I saw two different instances. One person had gotten dropped off at the end of the road, and they were on a walker trying to get back to Grace Marketplace. Someone else was walking. So this is really, really important in addressing the most vulnerable of us. And I said this a couple of weeks ago when we were having the RTS discussion. It is so frustrating to me to feel at the whim of the University of Florida. I don't like that feeling, that sense of powerlessness that we cannot help the people who are depending on us. I'm not sure where our county colleagues are on this, but this is something that I know all of you actually share the same sentiment about wanting to help the most vulnerable. For me, it was about listening to the testimonies of people who need to have the opportunity to try to get to work. It was about hearing the opportunities that people are missing in that way with the elimination of this route. It was about hearing how people need to continue to get to health care. We just had a whole conversation about mental health earlier today. And a lot of these individuals need the opportunity to preserve and get to a better place mentally. Quality of life. Quality of life is what these people are asking us to help them maintain and a better chance at it. So I'll conclude my comments by saying we need help. We need help so that we can help those individuals, the most vulnerable among us, who are depending on us, until we can find a better way to fund public transit here. Thank you.
Thank you, Commissioner. Commissioner Prizziat.
Yeah, I had brought up, I'm sorry that I was just out of the room, I had used the restroom, but I brought this up at MTPO, and I brought it up again to our commission, because it really is important to me as well. It's important to me because some of the most vulnerable residents count on this bus, but it's also, it's also a bus line that's near our airport and then gets people into downtown. And so it reduces people's reliance on needing to have cars, right? Because if they can take a bus and they can stay downtown and they're coming for a meeting with one of you all, or they're going to the university, and they can connect to the university and stay at the university hotel and not have to drive around our community. So to me, it's an important route that makes an impact on our goals around regional transit and using it as an alternative to single occupancy vehicle transportation, as well as serving some of the most vulnerable residents in our community and their ability to get to doctor's appointments, to get the medications they need, to get to jobs and everything else that they might need to do, because otherwise they have no transportation. So I am in favor of figuring out how we refund this bus route, because I think it's a really critical one, and both for economic development and for supporting those in need.
Thank you, Commissioner Prizziat. Commissioner Cornell.
Yeah, so to Commissioner Willis and Commissioner Eastman and Commissioner Duncan Walker, this came up because we were renewing the RTS contract. And each of the county commissioners said exactly what y'all basically said, which is if we're ever going to restore a route, it has to be this one. This is our most vulnerable citizens. And so we said, let's put this on a joint meeting. Let's figure out how to pay for it. I said, I want the city to pay for it. Anna said, I don't know if you said, let's split it. You might have said, let's split it.
Want it done.
Yeah, she just said, I want it done. And so I am expressing the desire to add that back because of all the other things that we've discussed with regards to Grace and the central receiving facility and really everything that we talked about today except the Hoggetowne Faire. And so I'm happy to split that cost if that's something that you all need, and I think it's appropriate. I haven't said that to my staff yet, so they hate it when I do stuff like this, because now they got to go find $50,000 in the budget. But I felt like of all the priorities that we have and the routes that we have that we're paying for, this to me is as important as those. And it seemed to me, and I've heard two of you now say that it should be as important to you all, and I was hoping to have a discussion to hear that, because if it is, let's solve this problem for our folks at Grace. The airport is less of a concern for me. I think most people that get off an airport, get off a plane, take an Uber, or they have a ride. I think most of the people going probably don't take the bus. I'm really focused on the fact that we spent as a collective body through the MTPO 7 years to get a light for the people at Grace. And that light was put there because it was on a bus route. And so once we got the light and then we eliminated the bus route, I was like, what the hell is happening? Like literally, what the hell is happening? I don't understand. And it's because I didn't know actually till today, Mr. Parsons, that it was fully funded by UF. I completely understand now. You guys have budget constraints, it's fully funded by UF, got to cut it out. But I think in this case, because it services Grace, and we got a light put there, and every time I drive down 39th coming in from Melrose, I see folks in wheelchairs and walkers sitting at the bus stop, and now they don't have a place to get on the bus. I was like, this is the route that we need the most. So I'm happy to split the cost if you're willing to split the cost, and let's restore the route.
Thank you, Commissioner Cornell. And before we go back around, let me, I'll weigh in here. We spent a few days ago at the City Commission meeting a long time talking about more than $3 million worth of changes to RTS. And none of those were positive changes. Those were all, money that just disappeared. We are unfortunately in a position, and I'm going to be careful how I say this because I want everybody to understand that your city is okay. We're not, if somebody is in the media and prints, the mayor says we're in a budget crisis, you're wrong. We're not in a budget crisis. We have choices, we have levers to make sure that the city is whole here. But our revenue continues to be uncertain.
Yeah.
We have to go find levers that we ought not have to find because one of our levers that we're supposed to be able to depend on is not dependable, and that's GRU. And that puts us in a position where when we say it's only $50,000, it's not only $50,000. It's a much more difficult situation than we ought to be in right now. Again, if you're watching this at home or you're in the media, this is not a budget crisis. We filled these holes. But we, again, just a few days ago, had a very long conversation about $3+ million of revenue that just went away. Because UF has different plans for how they're going to move students around campus or something. I can't figure it out, to be honest with you. So I would love to just say, yes, we'll fund that 50 grand, but I can't promise that. I'm not sure I could vote for that today. We are really not in a position to add that to the existing issues that we have with funding what has been to this point one of the better transit systems for a community this size in America. So I need to put that out there, and I don't think anybody's going to question my long-term commitment to funding homeless services in general and Grace particularly. I mean, we fund and will continue to fund this year more than $2 million of our $166 million to Grace Marketplace directly. So we are believers on this commission in funding those services and will continue to. But it is a concern to add, another and another and another, 50 here, 20 there, 75 there. It adds up in a big way to services that we are doing a remarkable job, thanks to our staff, of keeping whole in general. I just felt like I needed to put that out there before we move on. Commissioner Prizio.
That was actually for Commissioner Engel.
It was me the whole time.
Okay, all righty.
Easy highlight now because it works.
So I just want to say I appreciate the county looking to step up in this and what a hard time it is, City of Gainesville budget-wise. We've got GRU is holding back money that by all rights should be coming into the general fund of the city. UF has changed up how it is they're funding RTS. So we're looking at $13 million-ish between the two of them that are just not there that were previously. I think these are temporary issues. I think long-term it is going to be obvious to UF that we're better off working together on these things than trying to run their own transit system. And I think that people in Gainesville spoke quite clearly several times, and I expect them to again, that GRU should be run by the people that it serves. But at the moment, we are struggling. So I really appreciate the conversation you're having of stepping up and helping out with this. Because again, I think we are much better when we're working together on these things, and we've got resources together that neither of us could do alone, and it's good to have this kind of partnership, so I appreciate it.
Thank you, Commissioner Engel.
I do want to throw one thing out. I guess I'm just interested, again, this may be something we refer to staff. I mean, maybe the best, I don't know what the ridership was on that route and how utilized it was and the times that it was most utilized, but maybe there's some analysis that staff could do to give us that information, and perhaps a fully funded bus route isn't the right solution. Maybe a point-to-point type solution, or some other, vouchers for Uber rides, or like maybe there's other solutions that we could bring that are more innovative or creative to the solution for providing rides from Grace to locations. Yeah, on the weekends. Right, on the weekends versus refunding a whole bus route. And so I guess if we could just maybe refer us to explore what options we might have to restoring transportation. I don't know. It's just a thought.
Second, yes, you do.
Just to be clear, this is only refunding Saturday and Sunday on our existing Route 26,
Correct. Yeah,
not
that's the
bringing
one
back
to
Route
clarify
25.
that. Yeah.
6 only runs Monday through Friday. That's our current issue.
Got a referral from Commissioner Prizia.
Oh, I got you. Okay.
Yeah.
Okay. All right, Commissioner Eastman.
Just so I'm clear, the motion now on the table is just to refer to staff how to okay.
Just
I think-
look at this option versus other options cost-wise. and-
Right. No, I'm trying to speak to the motion. I know it's not our motion. I'm aware. Just to I mean, as we pointed out, we have been, at least the whole time I've been on the city commission, just sort of in trying to figure out how to protect what we have built as a community over the course of many years, as we have had our budgets cut time and time again. Our last discussion showed that GRU Authority has taken roughly $17 million based on cuts from where the equation would have been from our previous $20 million cuts in order to get our debt reduction plan. There's another $3 million from RTS. One thing that I'm very proud of is that it does, like in our current budget, and correct me if I'm wrong, in our current budget, we have maintained all of our support for our homeless services, for Grace Marketplace within our current budget. Is that correct?
That's correct.
I mean, that was a hard lift, and I know that there was a lot of discussions internally about what that means, what does that look like, how are we going to do it. We've been able to hold and make sure that we are, holding up our end of the promises, things that, we've had discussion about as joint bodies since long before I came on here. But geez, as we're talking about how we're going to fill that gap, those are hard decisions. We are talking about service cuts, we are talking about tax increases, we're talking about things that we have to turn to people and say, how are we going to distribute this pain that did not come from us but came from outside of us, and how are we going to figure that out? And so I am not in favor of doing really anything to our budget and then until we're looking closer to our budget time. But I appreciate the motion on the table, which is more, how are we going to sustain the service? Because this is critical. We have put so much investment and time and focus into making sure that we have a way to get our homeless community into somewhere, that there is a place where people can land on their feet, and that's intimately tied into how people can transport themselves there. And so what we can do, how we can support that, I know that'll be a priority as I go forward and we look at this very, very difficult budget cycle, but I did want to kind of tie that into our overall budget. So that's all I have, Mr. Mayor. Thank you.
Thank you, Commissioner Eastman. Commissioner Duncan Walker.
Thank you, Mr. Mayor. I'd like to go ahead and move staff recommendation, which is the Joint City-County Commission agree to add weekend service to Route 26 and authorize the city and county managers or designees to execute related documents memorializing the commission's decision, subject to approval as to form and legality by the city and county attorneys.
I'll amend my motion.
The question is who's going to pay?
Yeah. And so now I heard Commissioner Prizia mention that she wanted staff to bring back, what was it, Commissioner Prizia, you wanted them to bring back?
Well, I heard her say.
My goal was to sort of find out, look at this option, if we're looking at funding it fully, if you were funding it versus other options, what other transportation options might we offer that might be less expensive? Could we offer weekend transportation options for the $50,000 that we were planning to give with other transit options like MV Transport or Uber vouchers, or I don't know what that would look like, but I was just trying to get creative, given that we also are in a bit of budget uncertainty. I mean, we're in a solid place. We don't have the same situation that you all are struggling with, but given we don't know what the budget uncertainties are going to be like as the economy shifts and things like that, I don't want to keep adding things to a budget that's getting ready to be delivered to us in a week. So
Anna, I wrote refer to staff to look at weekend options for Grace Transportation.
Yes.
Which might include restoring the weekend routes for RTS Route 26.
Exactly, or other things, exactly.
Or other point-to-point options.
Yes, correct. So I mean, if the city comes forward with restoring the route, then I would be in favor of us splitting that cost and changing my motion. But
It didn't sound like that's what was coming.
Well, I want to say this. I did hear at the very top when Commissioner Cornell mentioned that he would be in favor of splitting the costs. I did hear that.
Yep.
And I had not actually finished talking, and I'm not opposed to that.
Mr. Mayor, if I may.
Mr. Parsons.
I did want to clarify, so we were talking about $3 million. It's actually $4 million of a gap that RTS is trying to fill. And that's a combination both of UF reductions in terms of service, as well as we've had a significant increase in our ADA service costs from MV, as well as our insurance has gone up significantly. So come the FY26 budget year, as the commission heard last week, we are also contemplating another $1 million worth of base service cuts. That would be to the 5, to the 8, to the 15, and to the 43. We would be removing a bus from each of those routes as well. That's base service. So that is, again, on top of all of the other challenges we've had with UF reductions. I don't put that out there to be, bring everybody down, but it is a dose of a reality in terms of where we are with the RTS budget particularly.
Thank you, Andrew. So $4 million. Okay. So I wonder what it would be like for our staffs to talk about what the options are. That's what I heard.
Yeah.
And I think that's probably what might be most palatable and probably the most fair, because I know I don't want to try to cobble it together up here on my own, and I think that the safest and fairest way to proceed is to have both staffs to confer and see what they can come back to us with.
A mirror motion of Anna's? 'Cause
Yeah.
Your motion didn't get a second.
Second.
Oh, okay.
As a mirror motion, okay.
Okay.
It's a mirror motion. There was a motion on the table to just pay the cost, I believe. So what
No,
did
it
we?
wasn't.
That never got there.
Okay.
The first motion that was made.
Just, thank you.
So, Mr. Mayor, if I could restate Anna's motion. Anna, correct me if I'm wrong, and then you can say mirror. Refer to staff to look at weekend options for Grace, which might include restoring the weekend route RTS Route 26 or point-to-point services.
Correct.
So, yeah, okay. And that's, okay, so we have a motion and a second, and we have a mirror motion from the city.
Okay. All right, Commissioner Brizzi, did you have anything else to add to that, or okay, you good? I'm trying to catch up on the lights here. Commissioner Willets.
Thank you, Mr. Mayor. I don't know if Mr. Persons can answer this. I don't see Ms. Ramos in the room. Do we have any leftover ARPA funds that could somehow be used for homeless services if we were to help restore just this fiscal, or just through the end of 25, or anything there? Because I know we were working really hard to spend down all of our ARPA, and I don't think there's anything left, but I can't remember about some of the unspent with some of our support of different nonprofits.
I'm sure Cynthia is probably upstairs, yelling at her screen right now. I don't believe so. I think everything's been committed as of the end of the calendar year that we have already encumbered, if you will. So I don't think we have any extra funding. I think the commission had allocated some of that with last year's budget to Grace to supplement, what we were doing in terms of trying to fully fund Grace.
That's what I was thinking, and because we have tried to sweep at the city with the past two budgets and in the middle of the year with budget amendments. We have just swept every little last pocket of where there might kind of be funds where we could say, oh, that really is homeless services, and it's something that maybe even just for this year to help finish, or just the beginning of a year where we could help and then the county could help. We've really swept every last little corner, it sounds like, across our budget, as evidenced by our glowing audits as well. Like we have really achieved some great things under the manager's leadership in the past 2 years, but there's no little nooks and crannies left. We've really cleaned them out. So thank you, Mr. Mayor.
Thank you, Commissioner Willis. And I'll reiterate there that the last two Gainesville City Commission meetings, both a special meeting and a regular meeting, we had items about RTS, about this, not this line, but about RTS in general. And we did talk last week about the fact that it's $3 million or so, I'm talking in round numbers, that is not coming to us from UF, and the additional $1 million expense that comes as in the way of added insurance costs and a variety of other things for a $4 million gap, which you can read as 25% cut for RTS in the coming fiscal year. When we say that we've considered the options, it's not hyperbole to say that we're to the bone, and I want to continue to say that we're not playing hide and seek with several pockets of $100,000 here, $1 million there. We do have good solid reserves, but honestly, that's part of our conversation about how we balance the budget for the coming year. And we are committed by policy to a minimum of 25% of our operating budget in reserve on a consistent basis. So that is funded, and it exists, and our remaining reserves are in conversation about how we balance everything else. So this route by itself is a piece of the larger conversation, but we've had that larger conversation for hours at the last two meetings as it relates to RTS. We're not just hiding some money in the back until somebody says the secret word. That's not how this is going. The secret phrase, by the way, is GRU. So let's see how that goes over the next year or two here, because that is the difference maker. That's where we are. Commissioner Cornell, did you have anything to add?
Very briefly, this seems like a good place for me to insert this comment that I had an opportunity to speak to the city manager, and I want to just say publicly what I said to her privately, which is that I so appreciate the work that your staff does and is doing, similar to what I say about our county staff and the work they are doing. The discussion at the county commission when RTS came up was, we understand they're basically having to go back to zero baseline budgeting. Like you are at let's just start with zero and start adding where we have revenue sources coming in. And our discussion at the county was, okay, let's start at zero, but the first place is grace. That's from our perspective, we're heavily vested in that. And so I think this motion kind of accomplishes that. It gets our staff back to talking. We obviously, as co-MTPO body that funds RTS, have a voice in that, and I completely trust your staff and the work that they're doing in giving y'all your best options for how you're going to fund RTS. We just at the county think of Grace first, not understanding you may have to eliminate some base routes. As a county commissioner, you may have to eliminate base routes, but Grace, we felt really strongly should be at the top of that list. Now, if this motion results in your staff coming back and saying, guys, there's like 4 riders on the weekends, $100,000 doesn't make sense, I completely trust your staff to give you all that information, and then you can get back with us and tell us how to do this. And so that's where I am. That's why we asked to put this on the meeting. And I want the city staff to hear what I told the manager of how much I appreciate the work they're doing, because you're doing the work that your board is asking you to do. So
Very good.
That's all.
Thank you, Commissioner Cornell. And let me add two other things to this. As we consider further options going forward, I think, and I've had this conversation with some of you on the county commission before, I I'm not sure that we shouldn't be looking at a social services targeted, not transit system itself, but a separate vehicle that can work to achieve specific ends instead of saying this is all just part of RTS. It may be time to start thinking in that direction more seriously, privately funded perhaps, and there are a variety of ways to look at that. The other issue for us to start considering, and I obliquely mentioned this at MTPO and a couple of other times, but it's time to really start considering how we might pursue in this community a different model for RTS. We are one of 2 transit systems in Florida that is operated by a city. The other one's in Tallahassee, and you can make the parallels there. You can see why that is. They're either funded or either administered by counties or truly regional systems. And sometimes if you do a special district, you can tax as well. You can create a different funding source that is a more permanent funding source than trying to keep it all cobbled together from a variety of places. I love the fact that the city of Gainesville runs the transit system here. It's great. I emotionally am a big fan of that, but it is not probably the right model looking far forward in a growing community with lots of institutional partners. Just putting that on the table. Commissioner Prizio. Engel, gotcha. All right.
I just want to say that I think it's a good idea that we take a look at what is reasonable as far as the best way to get people from Grace back into town and vice versa. If what those studies come back with is the thing that makes the most sense is restoring bus service on the weekends, and what that's going to cost is $50,000 for either of us, I am okay saying I'm happy pushing for that $50,000. Like we're in a $10 million hole. The difference between $10 million hole and a $10 million and $50,000 hole is different, but I said I don't think that's the breaking point for us. I think if it's a little bit of money out of reserves or if it's a little bit of something, I think this is a temporary situation we're trying to work through, and if we've got some good partners that are working with us, I think we can find some way to make that work. If there's a more reasonable system and it doesn't make sense to restore bus service on the weekends, and maybe it's a small transit ban and that's all they really need, fine. But if that's what it's going to take to really address the problem, you've got at least my commitment on pushing forward.
All right, thank you, Commissioner Engel. Commissioner Prizio.
I want to say I echo your thoughts around the idea of really thinking strategically about a regional transit authority or some sort of larger body that sort of really thinks about this issue in almost every conversation that we have about people who are vulnerable, people who are challenged, people who are trying to find a way to make their lives better. Transportation is the number one thing that comes up. Rather it's in our rural, unincorporated area, whether it's our small municipalities, rather it's, our homeless shelter, like wherever we're talking about that, like over and over and over again, transportation comes up. And so I do think it's something that we as an MTPO body, we're not the MTPO today, need to think about and talk about. So, I won't make any kind of motion now, but I do think that once we have our new MTPO director and we've got a solid footing of that organization, I think that's one of the first things that we should task that person with, is thinking about a study that would help us to understand better what that would look like and what that would mean for our community. So I'll just throw that out there.
Thank you, Commissioner Prizio. Madam Clerk, what do we have for public comment?
Oh, I thought we already had called public comment, but I believe Mr. Kaliblau had wanted to speak to this
Mr.
item.
Bond, did you want to add anything to this?
Thank you for the special dispensation. I just wanted to comment on Commissioner Prisner's idea. You have stats from the recent past of when ridership was happening, maybe 2 runs in the morning and 2 runs in the evening, 7 days a week. And people would come to know when they better use it. And 'cause I don't know what Grace's current model is, but it used to be that there were people who could stay overnight and had to go away during the day and come back. So depending on what those times are that people have to clear out and then hope to return, you could just have a couple of evening, a couple of morning runs to accommodate that, and people would know that they have to congregate together as a bigger riding group for those times. The other issue that affects the whole system, and I continue to see, is driver morale. And you see those issues passed on as nastiness toward riders. So I think that's something management still needs to do a lot of work on. And I see it a lot, especially at the downtown station, when buses are pulling in and others are pulling out before the entrance are parked. And people can't transfer between moving buses. And if drivers are just angry and ignoring passenger service, that's driver morale.
Thank you, Mr. Blount. Anyone else?
Last speaker,
Okay.
Mr. Mayor.
All right, we have a motion on the table. Y'all want to go ahead and vote first?
Yeah, got a motion from the county commission. All those in favor say aye.
Aye.
Any opposed? Motion is unanimous. Mr. Mayor, before you get to your motion, I have to speak at an event at 6, so I have to leave it 1:45.
Okay.
And we're gonna lose quorum when I do that.
Right. For the city, all in favor, please say aye. Aye. Any opposed? All right, that passes unanimously. So I will ask on this next issue, what I am hopeful for, go ahead and introduce the item, Madam Clerk.
Thank you, Mr. Mayor. This is 2025-475 Gainesville Community Reinvestment Area Extension with the recommendation the Joint City County Commission affirm their support to renew and extend the GCRA and direct both the city manager and county manager to develop a draft interlocal agreement with a 20-year term that would include the following elements: a new joint governance structure to improve collaboration between the city and county, an expanded geographic scope, option 1 or option 2, and an initial 5-year project list, and 3 recommendations for an annual contribution from the city and county to the fund beginning the fiscal year after the interlocal agreement is approved.
Thank you, Madam Clerk. So before you get started, Mr. Smith, we clearly don't have time for a full-throated regular item here.
And we don't have a board.
Right. Let's get the presentation, and my hope is that what this does today is start the conversation thinking forward about how we continue momentum with the GCRA and what is available to work with from the GCRA. But I was never looking for hard decisions today. This is something for us all to think and work on so that we make good decisions and keep momentum rolling. That's what I'm hoping for today as we move forward.
Yeah, and I would say that we are coming right off our first workshop of our strategic plan. We do not have a full board, and a decision like this really deserves to have the full board to see it. And so I appreciate you saying that even though that's your staff's recommendation, it's not. It's just the introduction to a concept, and I have some thoughts I want to share, and I know my 2 colleagues do, but we're really missing 40% of our board, and I know they have comments. So thank you for kind of preference. Of course.
Commissioner Chestnut, before we get rolling here.
Thank you. Before we get rolling on this, do we have any idea of when the next joint meeting will occur?
Madam Clerk.
Off the top of my head.
Oh, okay.
If you give me 1 second and circle back to me, I can.
August or September?
Yes, it'll be in the next quarter.
The recommendation
Yeah, it's in the next quarter.
Right.
would
So,
be September 15th, I believe.
Okay, September 15th. There you go.
Thank you.
all right, so maybe this is a topic we should take in earnest September 15th, because I'd like to get to this item that you added to the agenda.
Okay, gotcha.
Yeah.
The manager comments.
Manager comment.
Yeah, let's just
Yeah,
let's
defer it
defer
until
this until September 15th.
15th until we have a full board.
Right, and you all have the backup here, and I
Yeah.
would encourage you to read through it and see all the things that have been accomplished. I will invite you all to, everybody, the July 18th, I believe it is. We have, and tell me if I'm getting the date wrong, but we have a ribbon cutting out at the Eastside Health and Economic Development Initiative, so you can see the infrastructure that we have built with CRA money out there. And infrastructure is not sexy, people will say, but I will tell you.
It is costly.
It is costly, yes. But when you stand at the crossroads of this new infrastructure out there, you can see, I can show you how just the infrastructure changes lives. Absolutely changes lives in some neighborhoods. And I want you to see that. So please do come out for that ribbon cutting. July 18th, yes. I believe it's July 18th, but y'all.
It is
correct.
July 18th.
Okay.
9 a.m.
9 a.m. There you go. 9 a.m. July 18th. I want to walk you through that because it moves me to see what's going on out there. So, anyway, thank you, Mr. Smith. I appreciate you. Great presentation.
Thank you.
It's a lovely photo.
Perhaps my best. Enjoy your summer break.
Okay, Madam Clerk.
Manager comment.
Okay, yes, let's go to manager comment. And the point behind this manager comment, I've had folks approach me a lot about asking questions about Celebration Point, and specifically with the ideas, concerned about whether or not public money is at risk. I tell them I don't think it is, but so we got a joint meeting. It's an opportunity for a brief the opportunity to talk about that.
And Mr. Mayor, as much as you've been approached, I guarantee you I've been approached a couple more times. So,
I'm sure.
And we had a little briefing at our last meeting, and so, Michelle, you are recognized.
Thank you. Michelle Lieberman, Alachua County Manager. Yes, as far as the event center, we did send as the county a default notice to the operator of the event center, providing 30 days in which to cure. That default notice had a couple different parts to it. A lot of it had to do with some reporting structures, reporting timelines that were not met, and then there were some fees that were not paid. But to be clear, those are not fees that are owed to Alachua County, and I think there's been some confusion and misunderstanding to that. They are fees that are owed to the Community Development District, not to Alachua County, which is a separate entity for the use of the property. The CDD, as a lot of people know it by CDD. So that is where the fees are owed, but that is part of the obligation of the operator is to pay that fee to the CDD. So the CDD is owed. To date, the county has not put any funds into the general operation of the facility, and it has been open for approximately, 2 years now, going on 2 years. But this is our protecting the interest of Alachua County in the facility. That 30 days puts us to around the first meeting in July. Our first board meeting, actually our only board meeting in July, because then we go on commission summer break. So we will be doing another update to the board in July with the response to our notice of default.
So my understanding is that the county owns the facility, the sports facility.
Correct.
And you have an operator that is paid to operate the facility, so you don't have to have county staff operating that, right?
Correct.
And then that group is supposed to be paying the CDD. Is that accurate?
Correct.
Okay. So the flow of funds does not include the county anywhere in there. Okay.
At some point in the contractual agreement, way down at the bottom of about item number 10 out of things to pay is if it is profitable and if the percentages of profit have already been shared with the operator and manager as an incentive to generate the profit, then, and there's a reserve of at least, I believe it's $1 million, anything over that would be shared with the county. We call it the waterfall. It's way down in the line because there's a lot more important things to the operation of the center than generation ultimately of a profit to the county.
So the intent of the public money spent there is to get people to show up and spend money that therefore flows back into.
Which has proven successful.
Correct. And it is, and the facility itself, because we own the facility, the operators, the operation of the facility does not pay the bonds. That is tourism money. So we continue to pay on the actual facility, and we own the land that the facility sits on, the actual footprint of the land, so that's not in jeopardy either.
Okay. Very good. Anybody else have any questions about the Celebration Point issue? And not about all the private issues with it. That's a whole other story. Commissioner Willits.
Thank you, Ms. Lieberman, only because I'm less familiar. Are there any issues with the actual street transportation or street infrastructure, particularly the part that goes, just from the city out to the sports facility? In all of this large, financial issue, are the streets going to remain open so that people from Gainesville can get to the facility whatever else happens with the rest of Celebration Point.
So the streets, just like all the common infrastructure, that is all managed by the Community Development District, which is a government entity. So they will continue to maintain the roadway network, the lighting, all of that. They do collect fees. They collect fees in a variety of ways. There's an additional sales tax when you purchase anything out in the Celebration Point area, which is what a community development district is allowed to do to pay for its infrastructure as a government. It doesn't have true ad valorem capabilities to generate a millage like we do as a government, but it is a public government entity that has to have meetings like we do and meet certain requirements. It's a statutory creature, but it does have a way to generate funds even absent funds that are paid in, for example, by the property owners.
So the CDD maintains the roads. Have we heard any kind of danger that they're not going to have the funds? The roads are pretty new right now, right? They're in pretty good shape from what I remember. But there's no danger that, in essence, you're going to have a stranded asset, your facility, and you can't get from Gainesville to that facility.
They're in good shape, just like 16th Boulevard, which, I can bring up again. Don't bring it up. Oh, don't bring it up? Okay, I was going to offer it to you again.
Thank you, Manager.
Most 16 boulevards, that's y'all's problem.
Okay. All right. Thank you, Michelle.
Thank you very much.
Sorry.
I should take this
That's
opportunity.
a long-standing joke with Mayor and I.
I do want to compliment y'all on, while we're all here together, on 23rd Avenue out towards Santa Fe. It's looking really, really good out there. I appreciate it.
Finally spending money on roads.
Yeah. Okay, Madam Clerk, we have anything else?
Moving on to the next item is member comment for the city.
One of y'all down there. Commissioner
there.
Engel.
I did have a couple of comments. One thing I wanted to bring up, and one thing that's occurred to me since the meeting started. The thing that I kind of wanted to bring to this body, and again, this being kind of a joint issue, I wasn't sure the best way to do it, is Palm Point. Looking at it, I'm not sure it makes sense as a city park. It is far enough away that we would not hold the medieval fair there. It's a pain for us to take care of. We don't typically handle waterfront things. I think actually Public Works has to be involved in some of the maintenance of it. So I would like to look at the potential of transferring Palm Point, instead of being a city park, over to being a county park.
We directed our staff to get with your staff on that point
Awesome.
2 weeks ago.
Well, way to be on the ball there. And I know one of the things we had potentially talked about was swapping it for Squirrel Ridge, if that makes sense. If it doesn't, I don't know where anybody stands on that. But I just wanted to take a look at that, and I didn't know what that process looked like as far as, do we have to make a motion in the city? Does it have to be some joint board? Can we just send you a deed?
We've done it on our side.
Okay.
If y'all have an interest as a board, that would be something y'all take.
So it'll need to come back to a regular commission meeting.
Okay, so we'll handle that at a regular commission meeting. And then, since it has occurred to me since this meeting started, I would like to make a motion to fix this button and get Dan a better chair. But again, if I need to handle that in the city meeting, I can do that as well there.
I think staff hears us.
Good enough.
Commissioner Prizia.
I just wanted to, I had brought up the Palm Point idea. We a long time ago talked about the possibility of having better access to the lake for kayakers and fisher folk. And in that location, generally speaking, and we explored opportunities at the end of University Avenue where we own a small piece of right of way where the road just kind of ends there. Not feasible or viable for anything like that. So when we started talking about what could be other options, Palm Point came up, and so I asked if we could refer that to staff to sort of bring up, and Ken did the same. We're all kind of interested in that idea. I think we have a need for a park in that area. I think the park you all currently own could use some love, and since we need one and you have one, we would love to take it off your hands if you're open to that. I don't think we'd be up for trading Squirrel Ridge only because we just put a bunch of infrastructure into Squirrel Ridge and spent
That's
a
what
lot
we
of-
like best.
Yeah, right. Spent a lot of money on it, and I do think it's in our, you know, that's in our master plan for maintenance, and I'm sure you don't want something else to maintain anyway. So, anyway, that just wanted to throw that out there that we're excited about. I'm excited about the possibility of what we could do to upgrade a few amenities out there for access to the lake, maybe some bathrooms.
Very good. All right, I don't see any further lights, so thank you all for that expeditious last few minutes of this meeting. We really plowed through some items there, huh? All right, we are adjourned.